Lane County Budget Committee. I will call the meeting to order at 1:36. And our first item of business is committee business. I know that we have the May 8th set of meeting minutes. Have folks had a chance to review those?
I have not. So maybe I'll just abstain. I haven't reviewed them.
Any questions on those, or if not, a motion to approve those
I
minutes?
move to approve as presented, please.
Thank you.
Second. Or whoever.
Any discussion?
Can you tell us who seconded?
Greg.
I think it was me. Yeah.
Oh, okay. They are the briefer version.
All
I
those
can
in
do.
favor?
Aye.
Any opposed? Okay, motion carries. Those minutes are approved. Thank you. Any other committee business?
Not at this point. I think I'll cover a few things at the end. Thank you.
With that, I am pleased to welcome back the Health and Human Services team for their presentation today, and I will turn it over to you all.
Zach Evans, Assistant Director for Health and Human Services, and Pauline G. Ohe, our Division Manager of Behavioral Health, is joining me up here. Potentially Olivia, maybe.
Yeah, we'll switch seats.
Doing this job.
Yeah.
Okay. So, as we talked earlier this week, Health and Human Services is a large and complex department organization here within the county. We talked about community health centers, the Human Services Division, Public Health on Tuesday, and today we will focus on behavioral health. So, behavioral health, state and federal revenues are almost 87% of the total budget, so significantly dependent upon going into next budget year, what happens in Salem for the biennial budget, and then what happens in Washington DC with the federal appropriations. And then fees and charges, so for seeing patients in the clinics and being able to bill Medicaid or Medicare or potentially commercial insurance, seeing some revenue coming that way. The kind of major changes on the resources side compared to the current budget is there was an adjustment of, you'll see $804,000 from local revenues, and that is an error which will be fixed in the technical stage. What's sort of happening there is that the City of Eugene is funding, as we talked about Tuesday, some funding for the Human Services Commission work. And they have attached some of their opioid funding that they receive to that pot of money. There are specific terms and conditions with the opioid funding. So the funding that they're setting aside for that work is actually going to the Lane County Treatment Center. And then the Lane County Treatment Center is filling the gap. So that way the opioid money fits within the terms and conditions of what you have to use it for, and we are still keeping, in this case, the commitment to the City of Eugene whole to the Human Services Commission. So that's why there's a negative there. It's supposed to be there, it just got removed late. Okay, so that's resources. So on the expenditure side, we're seeing personnel costs go up almost 12% or $3.1 million compared to the current budget, and a decrease in materials and services. And as I mentioned earlier in the week, public sector in Oregon with our PERS system should see personnel to be 78% of your budget. That is not the case either with behavioral health, because we run a contract or a subcontracted delivery system for behavioral health services in the community. So a lot of money coming in from the state, a lot of money going out to support this work in Lane County. So with that, discretionary fund, general fund usage for behavioral health is in commitment investigation, and there was a reduction going into next proposed reduction of $80,000, and that was due to the state funding this work at a greater level than they have in the past. So we have additional resources coming in, and we are optimistic that that will continue. And I will turn it over to Pauline for a little bit of a description of what this work is.
Sure. So just to add a little bit to what Zach said, so we had an amendment last year to add just a little more money into the civil commitment. And what the state did is changed one of the service elements in our contract to allow us to move funding into the civil commitment work, which before was not allowable. So we have a little funding into the civil commitment work. It's largely still underfunded. So currently in session there is a bill that's looking at adequate funding for majority of the mandated services that we provide, and civil commitment is a part of that. So hopefully we'll see more funding coming into that work as soon as session is over, hoping that we get that money. So for civil commitment, we have a few FTEs that are doing investigations to determine if folks are eligible for the civil commitment criteria, and these people who are deemed unable to care for themselves or a danger to themselves and others. So we go through a due process to determine that they are indeed unsafe or unable to take care of themselves. So the process goes through the initial hold, and the individuals are often at the inpatient psychiatric unit, and then within 5 judicial days, we are required to have completed the investigation to then present a hearing, and a judge then makes a determination whether they meet criteria to be committed, usually for a total of 180 days. So our team is doing, in collaboration with the county council, is doing a lot of that work, and then determining whether people are under civil commitment. And then I'll have Olivia describe our programs.
Hi, I'm Olivia McClellan, Behavioral Health. And so our outpatient services consist of adult outpatient services. And so those are services for anybody about 18 years old until they no longer live. And we have folks that go through that continuum of services. We provide counseling, case management, peer support, and psychiatric services. And that's all done through a tiny team model where groups of clients, about 286 clients, are assigned to a team of about 4 therapists, a case manager, and a peer support specialist. And then there's a psychiatric prescriber that's assigned to that team as well. So folks that come into that from the community are typically our folks that are the most vulnerable. They're the folks that are accessing Medicare and Medicaid, uninsured, and then as Zach mentioned, we're starting to see a small bit of commercial insurance as well that we're able to provide services for. We offer groups, we offer counseling, skills training in the community for folks so that hopefully they can get to a point where maybe they don't need our services. However, a large portion of who we have are folks that will always need to be enrolled in services. So that's our adult outpatient side. We have a child and adolescent program that starts from pregnancy. We work with parents who are pregnant all the way through to transition age youth. So anywhere between the ages of 18 and 22, they can remain in the services. And it's a pretty comprehensive program. It does parenting skills, it does family reunification, it does counseling, individual counseling from everything from little folks all the way up to teenagers. We're present in 3 schools across the county where we work with the student-based health centers to provide care at the schools so they don't have to try to find a way to get to us on MLK. Our forensic services is pretty robust. That's all our required services. That's a part of our community mental health provider, our program requirements, and as a part of the CFAA. So we, in that we have our mobile crisis team is our newest team, and we have our forensic intensive treatment team. That is currently funded through the Criminal Justice Commission through the state of Oregon. And that's our sort of intensive outreach. It's sort of a step down from mobile crisis. It's an 8 to 5 program that goes out and works with folks that are in the community, folks that might not typically access care for a variety of reasons. They're folks that are considered our high systems utilizers. So they're folks that are either engaging with law enforcement, the emergency department, 911 at higher rates than the average citizen, and are not connected to mental health care. So this team gets to go out and do some really exciting work helping folks in the community. And we've just been able, as a part of that funding, we've just added recently a new van that's going out. And so we have a psychiatrist assigned to that team who is able to go out with a team and provide street-side medicine. So it's really exciting what the FIT team's doing. We have our Aid and Assist team. Aid and Assist are folks who have been arrested and who have been charged with a crime, but there is an assumption that the person is unable to aid and assist in their own defense. So these folks are, somebody is identifying through their process that perhaps they don't have the capacity to understand what's going on, and an evaluation's done, and then our team works with those folks to either provide legal skills training or to assist them once they have been in the hospital for 60 days, Oregon State Hospital for 60 days. We help them reacclimate to the community as well, and then provide some monitoring while they go through the legal process. What else do we have? We have PSRB, which is the Psychiatric Review Security Board. Those are folks who have been assigned the label of guilty except for insanity. So they may have served some time at the state hospital for restoration after committing a crime and being convicted of a crime. And then they're released into the community for further support until they're done with their service. And so we have about 55 folks in our community that are assigned to the PSRB team. And so we monitor them on a monthly basis. They have very strict guidelines, and then we do reporting back to the state. We have our forensic outpatient treatment team. Those are folks who are mandated either through the Department of Corrections, probation and parole, some of our mental health courts and municipal courts into treatment. And so we have staff therapists who monitor, case managers, and peer supports who work with those folks to support their mental health treatment, and then report back to the whatever system who has required them into our care. Civil commitment, sorry, there's a lot of them, so I'm trying to remember. Civil commitment team, I'm going around the building and thinking of where everybody's offices are. So our civil commitment team, Pauline already spoke about. So we have currently 3 investigators that are responsible for the investigatory part of the civil commitment process, as well as the trial visit monitoring. So if somebody has been, and I apologize if I'm talking fast. Lots to squeeze in. So this team also does post-commitment monitoring. So if somebody has been placed on a civil commitment, yet they're able to be safely in the community, we monitor them as well for the remainder of their 180 days. And so this team, not only do they do investigations, but they're also following those folks that may be in the community after. Like, who did I forget? I think I've got everybody in forensics. Yeah. And Mobile Crisis, it's our newest program. It's our shining light. We're really enjoying the work that we're getting to do. We've just recently dropped down into the day shift time, Monday through Friday. So we've been on the ground Monday through Friday from 6 a.m. to 3 for the last 3 weeks, and we're averaging about 6 calls a shift, which is low, but not awful for starting. We definitely pick it up in the afternoon from 2 o'clock on. Folks know that we're there and are accessing that service. So we have currently 9 staff on that team. We have 1 more QMHA to hire, and then we have 10 peer support specialists to be able to expand to 24/7. And so it's our hope, sooner rather than later, that we will have those services up and available 24/7. I've got everything. Let's switch.
I feel like I got a tour of the building.
Alright, so then just here for the FTE, we have seen some FTE changes in the last couple of years, settling in about 202. And that's primarily was 180 and a half 2 fiscal years ago, and now 202, and that's mostly because of the mobile crisis program.
So for the 25-26 changes, we continue, as Olivia mentioned, to finalize mobile crisis countywide coverage. We are hopeful that we'll be able to do this in the summer, sometime in the summer. We are still in recruitment process to essentially cover the overnight shift and also kind of just buffer the teams that are, as we see an increase in our utilization. The next big change will be our county financial agreement, which we are currently in negotiations with the state. The biggest change here is that we are revamping how the CFAA has been written and also operationalized. Instead of having, I believe, we've had over 70 service elements within the CFAA. And we are revamping that to consolidate all those service elements into 6 buckets. So those buckets are system coordination and management, behavioral health promotion and prevention, and crisis services, involuntary forensic services, outpatient and wraparound, and then we have residential services. So within those buckets, then we have the appropriate services to go under those as compared to what we had before, where each service had its own contract within the big contract, and also having its own reporting requirements. It's a lot of prescribed what you cannot do within those service elements. So this is consolidated, and there is also flexibilities within the buckets to be able to move funds around. So for example, within the forensic bucket, once we have the contract signed, we'll be able to move funding from PSRB, for example, if we find that we have extra money under PSRB and are needing additional resources for aid and assist, for example. So we'll be able to move funding within those buckets. Before these, we were not able to, without prior authorization from OHA, to be able to move that. And of course, that impacts business if you have to wait, for every time you need to move funding to be allowed to do that. So this will come with that flexibility, and also a little bit of clarifications with the language on what we can and cannot do within those packets. So it's simpler and I think easier to read and easier to understand the expectations. Before, it's just been complex and redundant and oftentimes very duplicative. So that is what we're going to be seeing with the new CFAA. Key initiatives, we talked about mobile crisis. You all are familiar with the Lane Stabilization Center. We are hoping that someday we'll have a stabilization center, so that's still in the works. And then we are going to be adding a satellite clinic in Florence for opiate, for the medication-assisted treatment. We're looking forward to that. There has been a gap, and looking forward to filling that gap in the near future. All right, I will start with challenges and then end with opportunities. So our challenges are not new. Most of them are challenges I've talked to this group about over the years. We still have gaps in the continuum of services. As we are launching and serving people with mobile crisis, we continue to see that really big gaping gap that we have without the stabilization center. So this is even more, it's leading us to really miss the ability to have a place to take people. So that continues to be a gap. We continue to have workforce shortages, although we are starting to see a trickle of applications within the different classifications that we have, there is still a big gap. We are also continue to see an increased demand in our services. I can't tell you how many times that we have to send people or refer people out because we don't have the capacity to meet their needs, although there are people that actually do meet the criteria for the services that we provide, but we just don't have the capacity to do that. And then, as you're all aware, we have insufficient housing, and it's even more so if you have a substance abuse condition or a mental health condition. So it becomes very hard to house the populations that we serve. And it's also made worse by the fact that for people who are needing residential treatment services, we don't have enough of those either for people to continue with their recovery. We continue to have unfunded and underfunded mandates. I'm hoping that will be resolved with the bill that I just talked about, with the cost analysis bill. It's House Bill 4092. The last session, the legislatures wanted to have a cost study analysis done to determine how much funding is required to do the mandated services. So that the first phase of that cost study has been done, and it shows that there is a gap of about $64 million biannually, so $32 million a year. So if that passes, we'll see that funding come into the services. For the county, it is usually for Lane County, about 10% of whatever the allocation is because of the size of the populations we serve. I talked about this, the CFAA, the opportunities and challenges with the contract. Well, it's going to create a lot of flexibility, and it's cleaner, it's clearer for us to be able to determine the expectations. The challenge with that is that we are negotiating this contract under the crisis that is the state hospital with aid and assist. So a lot of the language and a lot of the expectations are very, very focused on the criminal justice side of the house. So what we are seeing is a lot of pressure and a lot of desire from the state for the counties to be, quote unquote, the entities that are solving this crisis. And as we know, there is a lot of challenges for us to be able to do that. So that is the challenge. So currently, we are in disagreement with OHA in terms of the expectations and their prioritization of how they want us to do this work. So the focus is the one above everything else. We have to do the support, aid and assist. So forget about the upstream work that we do very well. They want us to be in the trenches of solving the crisis that is the aid and assist. So we are in a disagreement about how those expectations are coming down. And then there is the general, like everybody, the uncertainty with the federal landscape. We are very, very dependent and reliant on Medicaid, and any change to Medicaid means a change to how we deliver services in the community. Opportunities, there is of course an interest and investment in behavioral health services. As you know, the governor's proposed budget does call out behavioral health services as a need, and we are seeing, even at the state level, just that really focused attention on addressing the behavioral health system. Yeah. All right, questions?
Commissioner Lovell?
Dr. Pauling, did I hear you correctly? And it was your question, was the state's only funding us for mandates at 10%? So does that mean 90% of it falls on the
No.
county responsibility? I want to make sure I heard that right.
Okay, so I met with if we get the new monies that under the cost analysis study, however much we get allocated, usually we get a 10% of the total state.
Oh, gotcha.
Sorry about that.
Additional investment of 64 million into the system, we could expect about 6.5.
Yeah, correct.
Just to add, that's the formula sort of statewide you'll hear from Community Justice and Rehabilitation Services, similar to the Community Corrections Act, right? Lane County tends to get roughly 10%, 11% of the when it's allocated statewide, we get about 10% of funding for various services.
So the formula is a different, the problems with the formula is a different problem.
Right.
This is a problem of an inadequate amount of money going to a flawed formula. So it's like
Right.
chipping
Yeah,
away.
the formula is not ideal, but it's the formula we have. So
Yeah.
usually using the current formula, we usually get about 10%.
Can we just sell hoodies that say something's not ideal on it? Maybe we'll make some money there.
Commissioner Tree?
Yeah, I also want to, Commissioner Farr might want to speak to this because it's something we talk about at LGAC and other places, and the study actually came out of a request from LGAC for the gaps analysis and funding. But just to sort of say into the record, it's always interesting when I'm grateful to the governor for prioritizing behavioral health, but then when you get down to the programmatic level and this doesn't come from the governor's office, to continue the focus on trying to relieve the pressure on the aid and assist population without the upstream investments, those two things, they have to work together. So it's sort of setting a goal but not setting us up to succeed in helping to meet it. So it was a big step to get that analysis at least done, that funding analysis for statewide behavioral health. So I don't know if you wanted to add anything about that, but like every step we can take is helpful.
Well, we're tilting at windmills quite often in that, but it's a consolidated county. All 36 counties presumably are represented at LGAC, and Director Gray is a voting member of that committee. And we do have the direct ear of OHA director, who is on maternity leave right now, but she listens when Eve talks. She listens, and I can't see his face right now, but it's really, rest assured that we're in good hands in terms of getting our message heard. Now, the next thing is, do we get a response to the message? And we're in a holding pattern on that. We meet next Friday.
Yes, they do.
So I just wanted to know if there are any questions on the memos. We did have the two that we discussed on Tuesday with the numbers in them. The third is a new one for 2 vacant position reduction within the community health centers. The leadership team reviewed the volume of work of their eligibility team, and they determined they did not need those 2 vacant positions anymore.
Any questions on the memos from the committee?
I have just one quick question. The WIOA grant, is that a 5-year grant? Is that right?
I believe historically, yes. This one did go to RFP early.
Right. And it was awarded, though, for a 5-year.
I'm not
So
sure.
it would go, theoretically go back out for RFP in 5 years.
I am not confident in the answer to that.
Okay, that's good. Thank you.
It sounded like it was awarded with an option to increase up to 5 years, so I don't know if that's, I don't know if it was
That
awarded
triggers
for
an
the full
RFP
5,
then.
yeah.
But it wasn't a year early. It went out a year early, though, you said.
It went up.
A year ahead of.
Any other questions from committee members? Thank you so much to the group for the presentation. Thank you. Congratulations on the progress with the mobile crisis services. It's really been great to hear about that sort of over the last several years.
100% basically making it happen, so huge props to them.
Pauline, are you still taking shifts on the rooms?
I was on a break for a little bit, but I may be taking a few. We just lost a supervisor, so I may be going back to. Not too bad though, but we'll get there.
Okay,
Yeah.
good to see you.
Incredible work. Thank you.
Thank you.
Welcome to the team. We'll let you all get settled, and then we'll turn it over to District Attorney Pelosi.
Just as I saw you last night. That was
All right. Be working this right-handed, which is dangerous for me.
Are you left-handed? What?
I'm left-handed, yeah.
Well, you need.
Well, shall I?
Yes, welcome.
Thank you.
Yes, we'll turn it right over to you, District Attorney.
Well, good afternoon to everyone. For those who don't know me, I'm Chris Perosa. I'm the district attorney here in Lane County. There's many faces in here that I recognize from past budget committees, but I don't know that we actually met at any point during that time. So it's a pleasure to be with you all today. For the commissioners in the room and staff, of course, it's always an honor to be with you and spend time. I'm going to ask for some indulgence in this presentation in that I know, looking around the budget committee members, that many of you have ultimately been here and done this before, so you've seen this slide deck presented to you. You know what our office does. You have the SOS forms, which essentially provide the same information that you're going to see regurgitated in the slide deck that we present today. But I want to talk to you, what those forms in this presentation ultimately are not going to show you is essentially issues that are in existence at the district attorney's office today. They can't be necessarily qualified by numbers on a page. So for those who haven't heard me talk about this before, I ran to be the district attorney of Lane County for two primary reasons. The first is that I believe that the fair and ethical prosecution of legislatively enacted laws promotes social order, which is good for our communities. The second reason is that we in the district attorney's office have some of the hardest working, dedicated public servants at any level of government, frankly. These are really great people who work their tail off. But make no mistake, we are in a precarious time in the district attorney's office and frankly in the criminal justice system, the entire criminal justice system for Lane County. The nature of our job, in particular, the district attorney job, and the workload that's associated with any individual case has doubled, if not tripled, in the time since I became a prosecutor in 2004. The criminal justice reform movement, coupled with the massive proliferation of digital media evidence through surveillance videos and body-worn cameras, cellular telephones, have dramatically increased the time necessary to evaluate, process, and ultimately disclose the powerful information we can now have in criminal cases. With these resources, while these things, this digital media is an amazing and powerful tool to ultimately finding the truth, it has created a tremendous burden on my entire staff that ultimately is not often recognized or reflected around society. As a consequence, an attorney that may have been able to competently handle 100 active cases in 2004 when I began my career may only be able to competently handle about 50 or 60 cases today because of the volume of evidence they have to deal with in a particular case.
Can you say that again, Chris?
In 2004, it was not uncommon for DAs to have 100 active or even more active cases at any one time. Today, 100 cases would absolutely overwhelm a person and probably drive them out of the job in no time at all. So they can handle about 50 to 60 active cases at any one time.
So roughly half because of technological
Exactly,
advances.
because
and
of
other
the time that's necessary to dedicate to watch hours and hours of body cam videos, surveillance videos.
Way more information.
Way more information. It's really great information for finding truth, right? But it just requires a ton of time to ultimately be able to know what you're doing in a particular case. The DA's office has 24 criminal division attorneys. That's one less than we had in the mid-1980s when we had 40% lower population, and it's one less than we had in 2004 when we had the American Prosecutors Research Institute come into our office and conduct an extensive study that ultimately indicated we needed 7 more prosecutors at that time when we had 20% lower population than we have today. All of this is just to say that the workload under our current resources is not going to create sustainability in my office for very long. We have traded largely on youthful exuberance and dedication of our employees in a way that ultimately is not going to be sustainable over time. My fear here is that we are going to return very quickly, probably in the near future, to a situation like we had in 2021 and 2022, where we saw a mass exodus of attorneys from our office. This is in large part due to the fact that societal perspectives are beginning to change on work-life balance, and we're all seeing it. Every department in this organization is seeing that, right? People are not wanting to work long hours for limited pay the way they once were, and we're seeing that in both our attorney staff and our support staff. It's frankly giving our attorneys and our support staff the work of multiple people is just not going to work for us for much longer. And it's frankly no longer acceptable, and I'm loudly calling attention to what I believe to be a developing crisis here in Lane County around this. We've heard much concern over the course of the last several years about a public defense crisis. I want to give you some reference on what we're talking about. We have 50 local indigent defense attorneys, and they don't carry 100% of the cases filed in the Lane County Circuit Court. We have many, many, many highly respected, very qualified, and very good private attorneys who handle the people who are the non-indigent defense people as well. My staff, by contrast, is 24 attorneys that handles every single criminal case that's filed in the Lane County Circuit Court. And we carry the burden of proof in each of these cases, meaning that we're the ones who have to prove the person did what we say they did, and it's not the other way around in the criminal justice system. They don't have to prove a thing in court. Every case is obviously important to someone. It's important to the victims, it's important to the community, and of course it's going to be important to the criminally accused person. But we're now at a point where I'm here to tell you we're reaching a constitutional level crisis with the amount of overwork that my attorneys are going through. How is it possible that you ask these 24 attorneys who manage, and staff, who manage 5,500 to 6,000 criminal referrals a year, to know that they're doing the right thing when they don't have the time to review all the evidence in a particular case? They can't possibly know if they're doing the right thing or not. They don't have time to determine whether or not they are doing the right thing. I recognize that this budget committee has limited tools to be able to address the issues that I'm talking about. But I'd be derelict in my duty as the district attorney to not let the community know and to let you all know of the situation we face in that office. The situation, from my perspective, is getting truly dire. I applaud the county administrator for ultimately proposing a budget that cuts the sheriff's office and the district attorney's office less than some other departments. But we need to start getting serious about addressing the county's revenue problems. I fear that we are about to hit a point in which we are going to see prosecutors leave Lane County again and probably not have the ability to hire them back here in the near future. I will consider it a failure of my tenure as the district attorney if I don't work with county administration and the public to ultimately get more support for the people in my office. And I know it'll be a joint venture between all the folks in this room to ultimately get that done. But I think it's important enough that I had to at least say that to you from the get-go. My plan with this presentation is not to read word for word the slides, because I trust you can all read and know how I've probably seen a lot of this material. I'm going to quickly try and go through as much of this as I can so that ultimately I can answer any questions you may have. These are the 4 units essentially in our office. There's criminal prosecution, which does what everybody in their mind's eye envisions a prosecutor's office does. But we also have a family law division that, in essence, is trying to enforce child support orders that exist out in our community. Death Investigations provides 24-hour, 7-day-a-week coverage for any unattended or suspicious deaths that occur in our community to determine what the cause and manner of death is in those. Our support services includes both our victim services, but also our criminal and family law legal support services. In total, you can see we have 81 FTE in our entire department. We have numerous sources of resources that we depend on for financing. The general fund is the big one. There's no doubt about it. I will point out a couple of additional things on this slide. Our grants are pretty de minimis, if I'm being frank with you. We received a grant from the deflection program ultimately to hire a paralegal to manage all the statistics to that program, and also to ensure that law enforcement is equitably offering deflection to the people who qualify or should qualify under our policy. And then we also have a treatment court grant that ultimately provides for one prosecutor to act as the treatment court prosecutor for all 3 of those programs. The other thing I would point is the discovery fees that are mentioned there. These are threatened right now. We rely on discovery fees ultimately to pay for the people who provide the voluminous amounts of discovery that we get from law enforcement and forms the basis of our evidence in our cases. We essentially have been for years and years and years allowed to provide reasonable fees for those when we turn them over to defense attorneys or to pro se defendants who ultimately want that. That is being challenged right now. And we tried to have a bill in front of the legislature. AOC was involved in that bill that ultimately called for a statutory change to say that discovery fees for prosecutors are reasonable. That bill failed, and Defense Bar knows it did. They're now challenging our ability to charge criminal defendants for their discovery. So I'm fearful that that money may go away in the near future. All of our units depend upon the discretionary fund, the discretionary general fund. That's a reality. Another problem that we foresee in the near future is that because of a decline in federal funding, but also at the state level of decision made by the legislature to not backfill 100% for support, our VOCA grant, which is Victims of Crime Act grant, is going to decline this year, we believe, starting in October. We've been told through projections that we can expect a 22% reduction in that grant. That means that we are going to lose 1 FTE in our victim services, which is already significantly understaffed. With regard to our expenditures, obviously, like I'm sure most departments that are going to appear in front of you, our primary increases have been from indirects. Our family law division it's not housed on the PSB and courthouse campus. Instead, it's in a building across the parks over there. The rent went up for that quite dramatically, frankly, just recently, which is an additional expense. Our medical legal death investigators have become unionized, which brought with it additional cost associated with that. We talked about the BOCA granting, the BOCA grant and the expected reductions there. The demand for digital discovery and psychological evaluations. It's not just a matter of the volume of digital discovery, but storage is really expensive of this material. And so it's just a real expenditure that exists to have to store this material and have it at the ready for both discovery, but also use potentially in criminal cases. Psychological evaluations are through the roof right now. About 50% of criminal cases have some filing for mental illness in them now. That is probably a 20 to 30%, or 20 to 30 times what it was even 5 years ago. Which is something we're struggling to keep up with. The criminal division, in reality, it exists of 4 teams, although I think you could say that we actually have 5 if you consider our juvenile division as well. We have a major crimes team that handles all the very most significant cases that come through our office. They're homicide, sexual assault, child sexual abuse, major assaults and robberies, things of that nature. An abuse team, which we just were able to put back online after having lost it in July because of personnel issues. They handle both domestic violence and elder abuse cases because there are similar dynamics in those cases. And then we have 2 general they're general teams, but they have both felony and misdemeanor attorneys on them. These 2 teams are really the workhorses of our office. They handle a wide variety of cases. They have the highest case volumes in their 2 units. The criminal division analyzed 5,620 cases, law enforcement referrals last year, again with only 24 attorneys, which makes caseloads way too high, way above state averages and national averages for prosecutors. We also provide 24-hour, 7-day-a-week pager coverage, meaning we're available to law enforcement for cases involving vehicular homicide, a police legal advisor who ultimately can answer any questions law enforcement may have 24/7. We have a person who's on the interagency deadly force investigations team that will respond to officer-involved fatal uses of force, and a criminal homicide pager for typically things that are murder in nature. Our death investigations team provides 24/7 coverage, as indicated for unattended, suspicious, and non-natural deaths. This is required by statute. The county is required by statute to provide this. We did about almost 17,000 comprehensive death investigations last year alone, which was a record then.
17,000?
I'm sorry, 1,700.
Okay. Ooh, scared me.
Sorry. 1,700, sorry. Yeah, which was a record for that, for the 2024 was a record, and we're on pace to surpass that this year, which is troubling.
Can I ask,
Yeah.
we do that on behalf of all the law enforcement agencies in the county.
We do.
But there's no reciprocal, we just take that on as a cost of a
Yes.
service.
And to be clear, they are not trained to ultimately provide the services, to ultimately do it. And they told us they won't do it if we lose it.
And they don't pay into
won't pay
any
into-
cost
they
share
don't,
for the
no.
cost of doing that.
Yeah, they do not.
Business model.
Get something performed without having to pay for it. Yes, it is.
Attorney, this one has a lot of information that I hope to distill really quickly for you. Obviously, mental health filings are way up. Like I said, about 50% of our criminal cases have mental health filings in them. These are extremely costly because frankly, we aren't getting this kind of psychological evaluations one would expect the state to be giving these cases. We're often having to rely on the ones that are coming from the defense bar who hire privately retained people to do it. and then just cross-examining them if we think that they haven't met the mark and their standards. But more importantly, they're extremely time-intensive because we don't have the funding to ultimately hire our own evaluators to do this. We're requiring our attorneys who have no training in psychology to ultimately have to learn and understand the psychological reports and then ultimately challenge the ones that we think fall below the mark in these evaluations. That takes a ton of time. And like I said, they have to learn it from scratch because most of our attorneys don't come into this job with a psychological background. There's also numerous hearings involved in these filings. There's a hearing to determine whether or not the psychologist has established the requisite requirements to ultimately find the person unable to aid and assist, help their defense attorney in their own defense, or but even after we do that, we have to spend several settings just trying to figure out what the right thing to do with that individual once we find that out. You know, are they going to the state hospital? Are they going to a secure rural facility? Are they going to stay in our community restoration program? There's just a lot of time-intensive work that goes into each one of those cases. House Bill 4002 was a recriminalization of controlled substances, passed in April of 2024. It, of course, increased the workload on our office in that low-level drug crimes are now prosecutable. We have mitigated that additional burden by having a fairly robust deflection program, which we can talk about more if you're interested. That includes not only eligibility for low-level drug crimes, but also quality of life type crimes like criminal trespass and things of that nature. Those cases are now eligible for our deflection program if there's a nexus with some level of drug addiction in the person's past. As mentioned, the caseloads per attorney in our office are way high, I'd say dramatically so. It's interesting that we compare for purposes of compensation ourselves to our statutory comparators of Clackamas, Washington, Jackson County, Deschutes, and Marion, when our attorneys are carrying about 30% higher caseloads than most of the attorneys in those jurisdictions. Adjustments to work schedules had to be made in our death investigations unit, and that's because with unionization, we had restrictions on the amount we could and when we could work those employees. The county administrator was gracious enough to ultimately hand us one new medical death investigator when we cried for help. And then we converted an administrative assistant position into another medical investigator position so that we could continue to provide 24/7 coverage on those. We are in the process of hiring right now. We had one come online last week. We hope to have a second come online, I think, next week, and we're still, we have a third position currently open in there that we are back to the drawing board and trying to recruit for now. The Lane County Deflection Program's been open since October, and we're very proud of early numbers. In fact, we've received high praise from around the state and even nationally in how we're running that program. We were one of the only, in fact, we're the only one, I think, in the state of Oregon that provides short-term housing with our program. That has had a tremendous effect on our ability to be successful in keeping these people actively engaged in treatment. And our navigation services have been absolutely incredible. We're really, really proud of how that program's going. Frankly, it's with more than, better than 50% of the people who go into the program either remain in the program or beginning to graduate from them. I never expected those numbers to be that high just based on the nature of drug addiction and how recovery tends to work. Our family law division, obviously in a situation where two people have children together but they don't remain in a relationship, they often go to court and get child support orders where the custodial parent gets an order against the non-custodial parent, and it won't probably surprise many of you to know that the non-custodial parent often doesn't pay like they're supposed to under court orders. Our unit, 4 attorneys and 11 staff, ultimately seek to enforce those orders by bringing them back into court and seeking some kind of remedy to ultimately get them to pay the money that is owed to the non-custodial parent, or to the custodial parent who's often a mother of young children. They are funded largely, 2/3 of their funding comes from a federal grant. The good news for us in this realm is that there is a large amount of support, bipartisan support for this program, so it's fairly stable funding. We're not real worried about it. But 1/3 of the money does come from the general fund. The benefit of the bargain is that we collected $15.8 million for local Lane County families last year as a result of this. And I'll tell you that only 13 jurisdictions across the state actually keep their family law divisions in-house. We and the state is the party who ultimately does the work for those other jurisdictions. We do far better than the state does in the in-house places at collecting money. We get our weighted child support numbers far exceed the state in ability to recover for families. And we also, it should be known that one of the other things is that our division will enforce the hospital care or medical requirements that are imposed on people. Some parents are not honoring their obligations to ultimately get their children the kind of medical care they're required to get. And our office will come in and make sure that those kids are seeing doctors the way they should, which is also very important and not often talked about. Again, the funding's stable. Unfortunately, our workforce in there has not been. We're constantly having employee turnover, and retention and recruitment has been an ongoing issue for that department. Support services, as I mentioned, is really broken down into 2 different units here. There's the victim services, which are obligated to ultimately by statute and by constitution to provide certain services, which you can read up there, to victims of crime. Last year, or really from July of 2024 to March of 2025, they helped 1,250 people seek protective orders. These are folks that were in abusive relationships of some kind that ultimately were seeking a court order to have a judge order that the person who was the abuser would stay away from them or be subject to potential contempt proceedings against them. They also helped 2,785 crime victims with the various services that we provide and reference above during that same time period. That's a lot of people to serve with a very small department. And the growing case, they're seeing, anytime our caseloads grow over in the criminal side, of course, their caseloads grow in victim services as well. The support services, these are really the unseen and unsung heroes of the district attorney's office. Without this group, there's no way we can do what we do as efficiently and effectively as we do in our office. Their cases are growing, and unfortunately, because of digital discovery, we are ultimately seeing them struggling to keep up, and unfortunately, we're also seeing mistakes being made that are actually imperiling the potential of our ability to prosecute some criminal cases, which is very concerning and troubling to us. We also continue to see the volume of post-conviction relief cases. It's gone down some since the initial Ramos decision. Ramos was the decision made by the United States Supreme Court that all criminal cases must have unanimous jury verdicts. That's well enough and good if you're looking at it prospectively. The Oregon Supreme Court applied it retroactively. So we're getting cases from the 70s, 80s, and 90s now coming back on post-conviction relief under the Ramos decision, and they still trickle in monthly to us, meaning that we have to go back and either re-prosecute them or make difficult decision to just simply dismiss the case and move on. We already talked about VOCA. Victim Services is, one way they're trying to mitigate their workload issues is to take on more volunteers. Our problem with volunteers, of course, is that they work the schedules they largely want to work, and they leave us more easily than permanent employees, and so we're constantly training new advocates who may or may not stay with us for very long. We're also engaged in cross-training of clerical staff, which I think has been really helpful, so that if somebody's out on an extended leave, is on vacation, ultimately gets ill, something like that, other staff members know how to do the jobs of one another and can pick up some of the slack there. One other significant burden we're seeing in the realm of discovery is ultimately that there, for some reason, has been this explosion of attorney withdrawals within the criminal realm lately. This creates a problem for us because now we're having to not only make discovery to one attorney, but often then we're having to do it to a second, a third, and in some instances a fourth and fifth attorney for a criminally accused person, largely because they can't get along with their other attorneys. Key initiatives for us. One thing I'd note about this particular slide is that if you look at them closely, these are the core services we provide. But we're at a point where we can do nothing more than venture to do what we're obligated to do. The one exception to that is that we are working really hard in my office right now to try and it is my commitment to build better partnerships with both law enforcement and many of our community groups, and particularly community groups that have been largely marginalized by the criminal justice system over time. To that end, we hired as an extra help employee a public information officer, the first the Lane County District Attorney's Office has ever had, a gentleman by the name of Miles Pendleton, who's a former president of our local NAACP. Who's been fantastic at helping us reach out and establish relationships with groups that otherwise there was just distance between us and an unexplained distance, if I'm being honest. So we're getting together, we're in the room, we're having conversations. It's been fantastic, and frankly, some really long overdue partnerships are being developed. The unfortunate part is that's a position that's going to be cut through this budget, which is really tough, but at least the relationships are now built and we can continue to move on that. With regard to areas of concerns, I don't know if this is truly a concern, but it is a cost. It is a reason why our personnel costs are rising so quickly, is that we had both of our major unions resolve contracts last year, the prosecuting attorneys and AFSCME. And so as a result of those contracts, we saw personnel expenses grow. The DA's office is in the courthouse, and for those who have visited our space or any space in that courthouse, you know that it's a mess, frankly, and it ultimately does not have the square footage we need to properly house the people that we have in our department. I like to say it's a 1960s building and filled with 80s equipment and decor, and that's being probably pretty generous in many circumstances. Some new initiatives I'm excited about. Last year, middle of last year, we started with our local law enforcement to include all of the major police agencies in our region, but also the FBI and U.S. Attorney's Office. We created an interagency Internet Crimes Against Children task force that ultimately seeks to try and reduce the amount of sexual exploitation of children that's happening on the internet. It is the primary way in which both exploitation and trafficking are occurring in our communities today, is they meet people on social media and other internet-based sites and then lure them to meetings and connections. We have had tremendous success early with this program. In fact, lately there's been numerous media reports of really encouraging sentences coming from a lot of the people who've been targeted by this task force. And we hope it's just a start. We hope to expand it. In fact, we hope to include the rural communities and their police departments here in the near future as they get resources, hopefully, to include detectives on the team. As mentioned before, we reinstituted an abuse team that is focusing on domestic violence and elder abuse. It's because of personnel, we only have 3 people attached to it, and they're primarily only doing felony domestic violence and then elder abuse cases right now. We hope to expand that in the future because those are very serious and important cases, and we see a need for that. Talked about the PIO, so I am happy to answer any questions folks may have.
Thank you for this presentation. I will open it to the committee for any questions. Commissioner Buck.
Thank you. You had mentioned earlier in your slides that you had to get some office space for family law and that it increased your costs.
They've technically been in that facility for many, many years.
Since 2014-ish?
Yeah, 2014, somewhere in that time frame was when we initially put them over into that building.
And so this is just the landlord increasing rates at this point. Is there not any other space that we own that we could move you to?
It's a good question, and one that I think has been, as I recall, had been bantied about a bit in the past. They have some security concerns because the federal government requires some very serious restrictions on security for them. I don't know if that was maybe a barrier in the PSB or in other places in the past. We can't, for example, we can't mix directly the family law division and even the criminal division, who all have security clearances, because they have access to information like social security numbers and financial information that we are not supposed to be in contact with. So the only person from my office that really has the ability to go over and interact in that building without chaperone is me, basically by law.
Okay, so that kind of explains
In the
why.
past, they've been located at the mental health building and some other places, but as the space needs for those departments have grown, they've been moved around a number of times. Mainly because they are 2/3 grant funded, it makes paying for a lease cheaper than it would be otherwise.
Right.
I see, thank you.
Other questions? Commissioner Farr?
Thanks, Chris. You know, a couple of things I wanted to make sure that I'm certain on some of the data that you're given. I've written down that what used to be a caseload of 100 because of technology, data discovery, et cetera, that caseload now is more like 50 to 60. So up to a 50% reduction in the number of cases that a single attorney can.
Yes, digital media is the primary driver on that, but there's also been a whole host of legislative and appellate court decisions that ultimately have increased the obligations on prosecutors over time. From, they could be as simple as reporting requirements, but they're often obligations that we now have that we never used to carry as far as duties that we owe to the criminal defendant in cases.
Which makes one attorney far less effective at dealing with cases.
That's correct.
Which is out of your control, out of anybody's control.
It's completely out of our control.
Yeah. And then when we're looking at 50% or more of criminal cases having mental health findings, that decreases the number of cases that a single attorney can.
It does, because there's those hearings and those motions are so time intensive for the particular attorney. Because imagine being handed a psychological report that may call for some mental disease or defect to exist, but you of course can't even speak the language of psychology. So you have to go train yourself not only on what the language of the psychology means, but what, based on maybe the diagnostic manual for psychology or psychiatry, what it entails what the features of that should be. What did this psychologist see in this person that would justify this particular diagnosis? And then to make a determination, rightly or wrongly, from an attorney, not a psychologist, as to whether or not this person got it right.
And then you have to go on stage in front of a jury to make the presentation.
Or a judge anyway
Or a
in these
judge at
motions.
least, right.
Yeah, and that can be very difficult.
So then, even if we had the same ratio of funding for the DA's department, because of the added pressure on each individual attorney, we'd still need close to double that funding just to keep the same number of attorneys with a reduced caseload because of outside.
I don't know that it would be double, if I'm being honest with you. As we run numbers and we look at it, if in an ideal world, if we had something similar to what proposals that the task force is talking about right now, to include like an income tax, the 0.5% income tax, would mean roughly $5 million more for the district attorney's office. With that, we could hire 10 new deputy district attorneys across several areas, and of course commiserate staff to be able to support those folks. In addition to a couple of investigators, we've lost investigators over the course of the last couple of budget cycles. And so those poor gentlemen are overworked at this point as well, and not able to do things like serve subpoenas in the way that we wish they were able to do. So we're heavily dependent upon law enforcement to do that for us right now.
With all the extra cash they have.
With all the extra cash they have.
Okay.
Mostly they're being good partners, if I'm being honest, because they know that we don't have the capability to serve the subpoenas.
And we see tremendous coordination between the departments. But if we could add 10 with a 0.5 income tax, would that be all criminal prosecution, all 10? Or
They would, yeah, we've come up with, as a staff, kind of a budget of what we would do with $5 million additional dollars. I didn't bring it, unfortunately, with me, but I know that 10 criminal division attorneys would be my ad. What I'm looking to do with, if I were to get money like that, would ultimately give bang for the buck to the community. What is the community going to get the most benefit from if we add that additional tax revenue to our budget? And obviously, in our world, it's prosecutors.
And currently in criminal, we have 35 FTEs.
And we have, in criminal, as far as attorneys, it's 24 criminal division attorneys.
And the other 11 are in different support roles.
Yeah, really, we only have 29 attorneys total. So there's the 29. We have 4 in family law, and then 24 in me.
Okay. And you. Then one last question on this.
We
We're
are
experiencing
hitting
this.
time, Commissioner Farr, so one last question.
My question is, are all counties experienced in this, or is Lane County singular in this?
All counties are feeling the pinch of ultimately the additional requirements that have been placed on them and the effects of digital media. The problem is that we started so far behind these groups that we're feeling it more acutely, I would say, than they are.
That was the answer that I was looking for. Thank you.
Thank you. Very important discussion. I'm sorry to cut us off, but we are over time, and this has been really informative, and thank you for the information.
Thank you.
Long answers to my short questions.
I know, I'm sorry to cut you off.
No, that's cool. I got my answer.
Here, is there any way we can get a chair or two? And that way you can tell them
That's alone.
well, all 3 of the managers are going to. Let's start with Cliff, just because he's going to go first. And if we can get.
You look at one side, things out of it, stepping out of it. Do that. And just read how you call them.
Do we have an idea
Stay on your side.
They find that
Process line now.
Unfortunately, the other side knows.
I don't know, I want that.
They have double the amount
Great.
Are you ready for this?
We are ready. Welcome, Director Rickoff. I will just turn it over to you and your team for your presentation. We are running a few minutes behind, just to note that in the agenda as well, so.
We'll try to speed up, but we've got exciting things to say. Chairman Marconte, members of the Budget Committee, thank you. Thank you for your service and thank you for this opportunity to present. I am Greg Rickoff. I'm the Assistant County Administrator, the Director of Community Justice and Rehabilitation Services, and I have the best job at Lane County. I get to work with the individuals that you're going to hear from today. Just very quickly, of course, Clint Riley running the deflection program, Kracia Brunsman, who is our relatively new manager of parole and probation, Patty Robb, who is somewhat new as our youth services manager, and then Lynn Smith has joined us. Of course, we've got Kelly Barlow, who is our most senior manager who does finance and administration. So Lane County's newest department, we serve as the public safety off-ramp. Our clients that need to make changes in their lives, and our job is to help make that possible. Humans, of course, need two things to change: the ability to change and the desire to change. We work on both of those. Substance use disorder and behavioral health conditions are frequently accompanied by poor insight. The symptoms of one's condition is not recognizing that one has a condition. It takes others to point that out to them, and that work, unfortunately, often falls to law enforcement and then to the work of our department. So our focus is on supporting justice-involved individuals finding a pathway out of the justice system by helping individuals develop, value, and utilize skills to live their best lives.
Great. Do you want to handle the rest of
Oh,
Sorry. Or Jennifer can do it from the back. Okay, if that works, yeah.
okay. I think we're on the right slide. Please note, I think the thing most notable here is that bottom line, the resources versus expenditures, that's not an optimal design. We'll talk a little bit about the fact that resources and expenses don't meet. Let's go to the next slide. Okay, an unreadable pie chart. Our funds are defined by uncertainty and distress. We are beholden to state resources, state formulas, and ongoing state commitment and attention. And that is a very vulnerable place for us to be. I was listening to Dr. Khashoggi talk about unfunded and underfunded mandates. I'd like to borrow that because I think that's where we find ourselves. We are currently unsure of all or mostly all of the budget for deflection, for family mediation, and for parole and probation. We do have general fund and the local option levy. We'll talk about that in a moment. The big pieces of this, the Community Corrections Act, these are state dollars that come in to fund supervision and the sanctions and services that support supervision. It's a broken formula. It ties funding for the biennium to case numbers that were accurate 5 months before the biennium even starts, and is based on a calculation that treats every individual in the system as if they're at medium risk, which is definitely not true for our county. Virtually all of our people are at high risk. So the funding mechanism right from the start is broken. We estimate that we're going to get somewhere between $26 and $31 million for the biennium. That comes into the system and then is reviewed by the Public Safety Coordinating Council. They'll make a recommendation to this board, but it does mean that we're at a place where we will be fighting over dollars amongst ourselves, and there's never a time when there's enough money in that equation. And do have some sympathy for your colleague Commissioner Seneca, who serves as the chair of the Budget Committee and will be helping us work through those issues. The same is true for the Justice Reinvestment Program. That's looking like it's between $3.9 million and $4.3 million. One of the amazing things about that tranche of dollars, it's designed for innovation and creativity. It's really looking to reduce recidivism and state prison usage, but it's tiny in comparison to, the Community Corrections Act. So there's just never enough money there. We also get some money from the federal government, mostly in terms of Title IV, and that's Social Security dollars for youth who are out of the home and are residing with us. It's a fairly small amount of money. We don't expect there to be changes, but we need to pay attention to that. We particularly need to pay attention to the state dollars. Let's switch over to our general fund, and we've got, so Youth Services has our general fund. Youth Services also collects 9% of the local option levy in order to operate 16 detention beds and 16 treatment beds. So we were looking at a 5% reduction in our general fund dollars that come in. It's not a match the way the levy requires a match in the sheriff's office, but there is significant general fund dollar contribution. We were able to find a 5% cut. 3 positions are going away. We had 2 positions go in supplemental 3, not relevant to this conversation, but just to say we're continuing to downsize. All 3 of those positions were supervisor positions. We took some cuts last year in some positions that were service providing. We thought it was important that we do everything we could to be strategic and surgical, and that meant reducing the number of supervisors. Of those 3 positions, if you were to ask me 3 months ago, all 3 of those positions were filled. We did have 1 person who voluntarily demoted. We had 1 person who left for another organization. 1 of those positions are filled. These hurt. I can't sit here and say there's no impact for this. We're losing talent, and it means that there's a single supervisor over a much larger unit. We think we've got a very good strategic plan to make that work, but it's going to be experimental. Moving right along, we did not take anything out of materials and services. We did a pretty hefty cut last year, and that has really impeded our work. So much of our work, whether it's the youth detention or the school for justice-involved youth, materials and supplies are really a necessary part of our work. So we're taking some time off from cutting that line, and that's why we went with the personnel cuts. Next slide. Just really quickly, no changes to administration, but our other distressed fund is the Family Mediation Program that really focuses on parent education, family checkup and services, and mediation for individuals that are going through custody disputes. There hasn't been enough dollars in this tranche of funding for the last decade. It's really been impacted when the Circuit Court of Lane County made the decision that all cases will attempt mediation prior to going to any adjudication. Agree with that in principle, but there's a lot of families, there's a lot of couples who mediation is just not going to be successful. But we're running through all of those individuals. We've been able to do this by keeping some positions open, by having top flight mediators who are absolutely committed to this work and are going at this at task. We did benefit this past year over a reallocation. The Oregon Justice Department looked at the dollars and saw there were some counties that were really underutilizing their dollars, and they actually reprogrammed that and gave it to counties that were utilizing their dollars. So that was kind of a one-time fix. We are continuing to lobby to help make that happen. So we're truly distressed on when it comes to the funding tranches that go to parole and probation. We're truly distressed when it comes to family mediation. Youth services we'll talk about. We've got a pretty strategic plan. And with deflection, we just don't know. After the first 6 months of operation, we're still hearing the conversations at the state level that will, and we expect in the coming weeks to know what kind of tranche we're getting. But let me turn that over to Clint Riley, who can talk to you about deflection.
All right, good afternoon. I'm Clint Riley. I'm the program manager for the deflection program for Lane County. So I'll zip through my slides here. So our mission is to create a system for local law enforcement to deflect individuals to resources, services, and treatment with the use of a peer navigator. For those that don't know, this is a brand new program that just started this year. Law enforcement has the ability to call on a peer navigator when it's believed an individual's criminal behavior is a result from an unmet mental health need or a substance use disorder. With the assistance of the navigator, this person can be deflected away from the criminal justice system and towards resources, services to include treatment. The program focuses on what we call quality of life crime. Those crimes are trespassing, disorderly conduct, low-level theft, low-level property damage, and drug possession. Our FTE, real quick on the last one, we've got 3 county FTE. We have a $2.5 million program. One position is the position I'm in. There's a program coordinator that also is in our program, and then someone from the DA's office, a paralegal. We have 2 huge contracts that do majority of the work with the individuals that get deflected. I'm going to talk about them now. So navigation services, ideal option. They have 5 navigators and a supervisor, and they are available to law enforcement 24/7, 365. We also have 20 units of housing with the Reveille Foundation. We've shown that these 2 pieces are really the success we're seeing in our program come from having navigators and housing. It's just been critical. And we're continuing to review the eligibility criteria, which crimes are eligible for deflection, and expanding when possible. We're also looking for additional pathways into the program. Police can call us 24/7 with no crimes held in abeyance. As long as it's a law enforcement referral, we'll bring somebody in the program. Program number since we started, I shared with some of you yesterday, we just got a live dashboard that's on our website that shows this every day. That's updated. And so these numbers will now be available to the public in kind of more of a live mode. 144 have been deflected. 68 are currently in the program right now. 12 have successfully completed. 67 have exited the program. 70 folks have taken Reveille emergency housing, and 101 different treatment, service, and resource partners have been utilized during this time. I just want to highlight that real quick. Over 50% of the folks that have come in this program are still in it right now. We're barely at the point where people are eligible to successfully complete through. If someone would have told me when we started this that 20% of the people would still be engaged, 50%, the navigators and the housing, I keep going back to those 2 pieces right there. And law enforcement having a different tool for them to use. Next slide. The top one, that's our housing program right there. So that contract comes with 20 housing beds, but also the people that you see in the picture, there's a ton of support going on there. And just a quick story. A young adult who came from generational substance use and homelessness is now fully transitioned onto medically assisted therapy and is living in a recovery house. You drop down below, that's our navigation team. And a mom of 2 who was living outside a rural community is now living in a recovery home, reunited with their children and attending college. These lives were changed in literally 3 to 4 months. It's amazing what you can do when you start to give people a little bit of support. Next slide. The deflection program is state funded. This was created out of House Bill 4002, which allowed counties to apply for 1 year of funding that ends on June 30th of this year. It's imperative the state continue to provide the funding for this program. And then also, second piece to that, the success of the program relies heavily upon treatment capacity in our community. It is equally important that providers in our community continue to be funded to meet the demands of those being deflected. And with that, I'll turn it over to Grisha.
Yes, so as you heard earlier, my name is Tricia Brunsman. I'm the manager at Parole and Probation. I saw some of you last year, I believe, but this is a lot bigger audience than was here last year. So thank you for your time. Most of you know that Parole and Probation and what we do is to supervise those clients coming out from the courts, from the prison, and from the local control. But what we also do is collaborate with partners to improve that quality of life, promote lasting community safety, and restore those impacted by crime. And so down below, what you'll see is we supervise a variety of units. So we have our specialized sex offender supervision unit, we have a domestic violence supervision unit, a mental health unit, the Way Home project that's continuing, which I'll talk about in a little bit, our Justice Involved Women unit, our Senate Bill 416 program, which is our downward departure, so those that were deflected from prison that are serving a probationary sentence. We have a variety of treatment courts, so we have veteran court, drug court, mental health court, and then our newly established SMART court, which is Springfield municipal cases, that's funded through the Springfield courts to supervise municipal cases that they'd like to see supervised, as well as transition services to the DOC. So our AIP program, it's an alternative incarceration program, so it severely cuts down those in prison. If they go through a pretty rigorous treatment program and in prison, they get to be released early and onto supervision. We have 50.25 FTE, and you can see the resources and expenses down below. Okay, so the changes for parole and probation coming up. So the long-standing reality is that PMP or parole and probation has not been adequately funded for a very long time. I know that's not new news to you all. You've heard that, I'm sure, numerous times. But our current funding streams are inadequate in conjunction with the lack of diversified funding. So with the passage of House Bill 4002 that Clint had talked about, we've seen an uptick in cases. Lane County has seen an increase of 150 cases coming into the program this last 6 months alone. And although community corrections is in a place to possibly be funded, either at the cost study amount or even the governor's recommended budget, it's still not in a place of meeting where we currently need to have services. We do have a slightly bigger pie this biennium than we did last. We're at a 9.17 as opposed to 8.77 the last biennium, but the rising cost of doing business for us is not going to allow for increase in positions regardless of whether we're funded at the governor's budget or at the cost study amount. In addition to that, our statewide contact standards continue, so I know we've talked about that before, but the state has issued a requirement that we meet our high-risk clients 3 times per month, our medium-risk clients twice per month, and that all those contacts need to be with a parole and probation officer specifically. So this increase in our contact standards for the division, we have not been meeting those standards. We just simply do not have the personnel to do that. And again, with the fully staffed DA's office this last biennium, the passage of House Bill 4002, we did see that increase in 150 cases in the past 6 months, like I said, which does equate to an additional 4 parole and probation officers that we would need to supervise those cases that we don't have. All right, next slide. So what I do want to highlight here is a program that works, and there's a reason why we're highlighting it. So the Way Home program continues to be a fruitful collaboration between Homes for Good sponsors and us. So it's 7 years in operation, and so this is, I know the slide is pretty small, but I'll read it to you. So the Way Home has assisted over 600 individuals. So we've successfully housed 231, issued 97 Section 8 housing vouchers, and remarkably, when we focused on that highest risk clientele, 87% of those clients still remain in stable housing, and we witnessed a 70% reduction in recidivism. So it went from 26% down to 11%. And the reason why I highlight this is because the continued follow-up studies continue to show these outcomes. And so what it highlights is that if you provide housing, you provide services to address responsivity issues and needs of the clientele, and you give an officer a manageable caseload, this is the outcomes that you can get. Next slide. So some of the opportunities, I like to highlight again our mental health unit. I heard a very brief snippet from Perosa, DA Perosa, about the uptick in mental health cases, and I can completely substantiate that. So our mental illness continues to be a major barrier. It's a responsivity issue for clients, and so many of our clients suffer from mental illness, and that number continues to rise. And so in order to address that, we'll never be able to address the drivers for that criminal behavior unless we address the mental health. So we really have a focus on our mental health unit and the work that they're doing, and it's pretty creative. They are a state leader in working with justice-involved individuals suffering from mental illness. So that unit engages in community outreach, and I know that I spoke to many of you a few months ago about our crisis stabilization grant that we just received. So that unit is engaging in community outreach with our clientele on a monthly basis. They're offering in-person reach-ins at the prison with the severely mentally ill. And then they're also running DBT groups, which are specifically cognitive behavioral intervention groups that work well with those with mental illness. So with this new 3-year crisis stabilization grant, we get to increase the capacity of what our mental health unit is doing. It's going to add an additional full-time PO to that unit. And then what it will also do is be able to identify the gaps in identifying clients that are coming through the courts and placed on supervised probation that we're missing right now that have severe mental illness. And then we will also have a crisis mobilization van to go out into the community and meet the clients where they're at and service them where they are at. The second great opportunity we have, and it's in its very infancy, is beginning the conversations to utilize the knowledge, voices, and experience of those that have been through the system to help shape and influence what is trauma-informed and what works in ways we can increase engagement with clients who are not reporting or failing to engage. So Sponsors has a reentry committee that meets regularly to receive input from those that have successfully navigated the system and have made their way out and who now have productive lives and are interested in giving back. And so Parole and Probation is in the beginning of also having those conversations to incorporate their ideas and knowledge to create innovative implementations so we can build and increase what works with those involved in the system. So I'm hoping that in those conversations, we're also looking to try and find creative ways to explore the concept of peer navigators and peer mentorship so we can see how we can get those clients that we can't seem to reach, that abscond to us, and get them into the system and engaged. And now on to the real fun stuff that you hear all about, I'm sure, are all the challenges that we face. So, yes, great, okay. So as a result of a funding deficit that has been created over years of underfunding Lane County Parole and Probation, we are prioritizing our limited resources to the very highest risk. We lack the personnel to supervise 500 high and medium risk clients currently. I am not supervising 500 clients currently out of a population of 2,300. So therefore, those clients are out in our community who are not being supervised because I just do not have the personnel to supervise them. So this coming month, we are implementing an intake unit to properly assess and refer clients to new to supervision, and will continue to adequately supervise our sex offense cases, our domestic violence cases, our treatment courts, and our mental health caseloads. We're capping caseloads to 40 high-risk cases to be on par with the rest of what the state is doing, as they have between 35 and 45 high and medium risk cases on their caseloads. So as I stated, currently 500 high and medium risk cases are not actively being supervised, and we are projected to have an additional 300 cases over the next biennium, which would mean we would need an additional 16 parole and probation officers to meet that demand of 800 cases. And in addition to those officers, there's a structural support that needs, that include 2 additional supervisors, 6 additional corrections techs, and then an additional 4 office assistants to keep us comparable to our comparator counties.
I don't think you mentioned what current caseloads are for officers.
Our general caseloads are sitting at 100 currently. We have 100, and we are only, and those are all high-risk cases. My medium-risk caseloads, our medium-risk clients are not being supervised right now, so my officers have 100 high-risk clients on their caseloads, and it's broken. It's not, we don't have the ability to supervise them. It's a smoke and mirrors to think that you can supervise 100 clients.
What would be manageable?
35 to 45. If we had 35 to 45 on a caseload, of even just high risk, and when you look across the state, we have 35 to 45 medium and high risk across the state. So when you hear your other county, counties suggesting that they aren't able to do the work, it just puts it in perspective that if they're having a hard time doing the work at 35 to 45 on a caseload, and we're at 100, what that means, what that looks like. And with that, I will turn it over to Patty.
Thank you. I'm Patty Bob. I'm the Division Manager for Youth Services. Good afternoon. I'm pleased to be here. I want to be sensitive to time, so I'll try to be quick. This is the breakdown of our current program. We have 6 areas, with the core being our administration services, detention services, and juvenile department. We are unlike all other juvenile departments in the state. We have a full continuum of services in our juvenile department. So beyond just detention and juvenile department, we have a clinical services program. We have a school, an MLK education program on site, and nutrition services that offers vocational opportunities for youth. So we have a full continuum of services for youth. The other juvenile departments have parts of that continuum, but not all. So that makes us unique and gives us lots of opportunities to serve youth. Our focus is accountability for youth, but also providing support and increasing resilience. Next slide. This year we are faced with some budget cuts. We did focus on where could we make reductions and not close programs. Again, having that full continuum, we really want to continue to keep that continuum in place. And this is, although one area that is not ideal, it was one area where we could do that and continue to operate with full services to youth and families. Our approach is that we will try to be creative and look for opportunities with a different model for supervising our staff, continuing to support a vibrant culture, and looking to reorganize how we do our work and do our work well. We were unable to reduce any further material and services cuts, as we mentioned, so we were really down to bare bones. So these cuts were, a lot of thought went into that, and that's the area we came up with, making changes. We have a lot of initiatives happening in the division. The pictures that I have up here are areas where we've had grant support or people have made donations. We have artwork coming in through the Servue grant. We had a body scanner that has definitely improved our trauma-informed care in detention. And we have some new hydroponic equipment that's helping to bolster our garden and culinary program. So there are some exciting and innovative things happening in youth services. We are in the process of piloting a risk-based supervision model in the state with OJD. We are also developing diversion and deflection services through grant support, pass-through dollars through the federal government, and excited about deflection. We feel like that's going to be a real place we're going to pivot and change the way we serve youth in the community, so they no longer need or require a criminal referral to get the help and services they need. We are looking how we can expand not only partnerships with education, but other community partners to strengthen the work we do. We don't need to do that alone. We have a lot of partners who want to step up and help us. We were able this past year to add a psychiatric and medication-assisted therapy program to help youth who are coming into detention, withdrawing from opioids. Now we can provide them with MAT services, not only in detention, but as they transition back out to the community, so there's no disrupt in medication delivery for youth. We also have a secure stabilization unit within our detention, and our focus has been stabilization, not only in custody, but when youth return to the community, keeping youth here locally, serving them, and preventing them from being committed to the state, to the correctional facility. We do have 1115 waiver services in the wings, and those dates keep changing, but that will become part of our model as we continue to develop, and we'll just focus on what we have before us until that funding does arrive. Next slide. So opportunities, again, funding is both an opportunity and challenge. When you have dollars that you're preparing to come and be here, you do what you can with what you have, and that's where we're focused right now. We have a lot of positives to focus on with what we do have, and how do we continue to develop our clinical services and our support for youth. So we're focused on those, what we do have right now, keeping in mind what we need to develop as we do have that 1115 waiver funding that comes our way. We are doing outpatient services. When we've got in the community, we're focused on transitional services for youth coming out of detention back into the community. And when 1115 waiver funding comes, we'll have dedicated staff to help bolster those services. The Serbu Foundation is we're looking forward to them providing us with a grant to develop deflection services. That will be a partnership with the schools and law enforcement, who will help with those referrals and partner with us to deliver those services. And as I mentioned, we have a state pilot that we're doing and expansion for education and partnerships. So I would say, although we're facing challenging times, there is a lot of opportunity and we're taking advantage of that. And that's all I have.
Thank you.
Thank you all. It was an excellent presentation. Any questions from committee members? Commissioner Buck and then Commissioner Trieger.
Thank you. I had a question for the deflection program. You had mentioned it's funded through June 30th of this year. And I was wondering if there was some kind of legislative update on what you think it's going to look like in the coming year or two.
I think we both got the same amount of information down. The governor has pushed forward the $40 million renewal of it. The difference was 36 counties, 28 got funded with deflection last year. And now if all 36 get funded and they raise the floor to give counties more money, what does that look like for everyone? And so we're waiting to figure out what's that final number gonna be. It'd be nice if it was 50 million, not 40 million, because that would balance us out to stay status quo. Can you add more?
Yeah, and we're lobbying to try to get it to 50 million, because at 40 million, it's just thinning the broth. And it's gonna probably create some shortfalls for us.
And every county is taking advantage of it now, it seems,
Yeah,
or?
we have certainly heard a report from CJC, the Criminal Justice Committee today that's looking at, there's a piece of legislation that's looking at a funding model that really is pay for success. 25% is base funding, 75% based on performance. And the thinking is, if that piece of legislation goes through, we are very likely to be one of the winners in that equation, just given the great success we've had with the program. So we're hoping that piece of legislation is passed, but it's just being considered at this point.
Yeah, my original question I'll ask in a minute. It's just a simple number question, but to follow on that. So are you saying the structure of the program is changing and it will no longer be an opt-in, apply for a grant, but every county will be required to stand up some kind of program and there'll be a formula? Because they could...
It will still be an opt-in program. Right. Sorry to cut you off, Commissioner. It'll still be an opt-in, but now that people have seen it starting to work, all of the counties that said, no, thank you, we're only interested in going the carceral route with these individuals, now we're jumping on the deflection bandwagon.
Perhaps, but as someone who has talked to some other counties, not all counties have stood up a program like ours, so what they think they're gonna get for their money is gonna look as different from county to county as it currently does until people catch up to this model, and then even if we went to 50 million, it wouldn't be sufficient.
Yes, I think that's true. There's a lot of counties that are using much more of a diversion model, and as opposed to deflection means before folks even get entered into the system. Diversion is for once folks are in the system. The treatment courts are a good example of that. We're also hearing that there's going to be a strong push for counties to partner and collaborate. Wasco and Hood River is already doing that, and we'll likely see more of those requests because that base number is just not making it for a lot of the rural counties.
Well, they've also set up different criteria for who's eligible to begin with. So that's something else that we've done that's more forward-thinking than most other counties.
DA Perosa and Clint Riley have by far the broadest definition of criminal activities that can be considered for deflection, and he has been an amazing champion. And I think they've led the state in helping understand how many different offenses could actually qualify for deflection and be successfully deflected.
My actual question that I was gonna ask, just there's a increase in resource under property and rentals, is that the pod rehab at Cerbo?
That is the lease agreement with Nexus Family Services. Yeah, thank you.
Thank you. Any other questions from the committee? All right, thank you very much for an excellent presentation.
Thanks a lot. Thank you.
For the committee, we now have a 10-minute break scheduled. Do we want to take the full 10? Do we want to take 5 and catch up?
Thanks, John. Thanks, John.
I'm hearing 5 from her.
We're only 1 minute behind.
Yeah, let's give the sheriff a five.
3:25 and it's
Catching us up
2:26.
there, CJRS.
That's right. We're supposed to be done. Yeah.
So I can't read.
Do we want to do a 5-minute break? and come back?
I'm not gonna waste 1 minute.
Okay, we'll do a 5-minute break. We'll be right back.
Call the sheriff.
That's short. With a car.
go ahead and call us to order. 3:30, and we are pleased to welcome you all. And I will turn it over to Chief Deputy Wilkerson.
Okay, thank you, Chair. Thank you, budget members and commissioners. It's always a pleasure to get to come talk to you guys about the Sheriff's Office. We could not be more proud of the men and women who serve throughout the various capacities of our office. But before we get started, I'm going to ask Tim Wallace, our PIO, to give you all a free gift from me. That's it's our annual report that we Tim spearheaded for us to kind of talk about the various aspects of our office, and just to give him a plug. Washington County has 8 different people in their PIO section for the Sheriff's Office, and Tim did this pretty much by himself, so we're pretty proud of the work that he did on this. So good job.
Thank you. Okay, don't forget him. I have just. Cool. Thanks.
Okay. Well, I would be remiss if I didn't start off today by reminding everybody that today is National Law Enforcement Memorial Day. That was inducted by President Kennedy in 1962 to honor the men and women throughout our country who have paid the ultimate sacrifice. This year, over 300 names will be added to the National Law Enforcement Memorial Wall, to include 147 troopers, agents, officers, constables, and deputies who gave their life in 2024. So, also I'd like to remind everybody that the Lane County Sheriff's Office has 8 names on that wall for deputies and sheriffs who have paid the ultimate sacrifice for our community. So I think it's important that we remember today and what it is. So I think it's a good thing that we're having our presentation today. Much like previous times, we are going to use today as an opportunity to, help some of our leadership team get some more experience. So you're going to be hearing from folks from different parts of our divisions. I'm going to start us off by talking a little bit about the Office of the Sheriff. So Tim, you have your, okay. So let me see what I'm talking about here. Mission of the Sheriff's Office: conserve the peace. That's straight from ORS. That's what the sheriff is supposed to do. And our values is we're committed to justice and integrity. We're sworn to protect Lane County, and we're honored to serve. That honor is something that I can't understate, that everybody at the Sheriff's Office has an internal drive to serve, and it's why we have, such amazing employees. Go ahead. I think it's important to talk about that since 2024, the Sheriff's Office has lost 1 FTE. We're going to lose 2 more in 26. And we're going to have a loss of a deputy and a lieutenant this fiscal year, for this upcoming fiscal year. I say we're moving backwards, and I think that's really what the point of today's message is going to be, is that there's a lot of challenges, some of them internal, some of them external, about the budget for us. Unfortunately, you're going to hear from Lieutenant Moore later that some things that we were optimistic about, like the 115 waiver, is likely not going to happen this year. I just got word that another one of our funding sources may get reduced because of the federal budget constraints that are happening. But for a county our size, we did a great job because of the budget committee and the commissioners of making some headway, and we are not doing that. We are now going backwards. So go ahead, Tim. The Office of the Sheriff is made up of Sheriff Harold through tomorrow, and then our Executive Assistant, Nate Hendricks. It is just one division of the office, but it's obviously a very important one, and I will like to take this opportunity to say how honored I have been to serve under Cliff Harold. He's been an amazing leader, and the county's got a big job ahead of them as they decide who to fill his position with. So I will be acting as the sheriff until the appointment process is completed and the application process for his position is complete. So I would like to take this opportunity to thank Sheriff Harold for all of his years of service, 35 years of service to our community, and he's been an exceptional leader and mentor to all of us. So, Tim? Honestly, most of you guys know how our funding is made up. we have a pretty, like a lot of departments throughout the county, we have a pretty diverse funding. For our funding is diverse in the fact that we have contracts, we have grants, we have the levy, we have general fund, and the sheriff's office in every division has multiple funding sources throughout those. So, and, this is a county provided slide. Just kind of shows the breakdown. You guys have that in your budget books. I'm not going to spend any time to provide it. Again, same thing. This is just kind of the base. The important part of this slide, I think, is that the sheriff's office, you know, is primarily the people that we employ. So see that, you know, materials and services and capital expenses are there, and they're expensive, but we spend the money on the folks who provide services to our community. And at this point, I'm going to turn it over to Lieutenant Ryan Wells, but I'm going to ad hoc for just a second and say Lieutenant Wells is one of the lieutenants in the Operations Support Division, which is what I currently manage. And we have AIC'd Lieutenant Spaldridge over there, who you'll soon hear from, to be an acting captain while I'm the acting sheriff to help me run that division. So I want to say congratulations to Lieutenant Spaldridge and turn it over to Ryan. So.
Thank you. Thank you to the chair and the budget committee and commissioners. Like the chief said, I'm Ryan Wells. I'm the operations support lieutenant, and I'm here to have the honor to talk a little bit about the operations support division. So as you can see, the operations support encompasses a large range of positions and is a vital part of the sheriff's office. Without stable funding, we have limited staff to complete all of these jobs listed. This requires great teamwork and many of those FTE being able to do multiple positions. However, over an extended period of time, that can lead to burnout and being overworked. This has a negative impact on our employees, our staff, because they want to do a great job. They all have an internal drive to make our community a better place. However, due to our staffing levels, this comes at a price. Because staff are completing the work of multiple positions, they not only are getting burned out, but they lose out on the opportunity to fully connect with the community. Many of our staff love to be a part of community events, and for the most part, we are unable to support them going to these events on duty. The sheriff's office used to participate more in the schools, and this was done because there was staffing to allow 1 or 2 employees to go. Currently, those employees are still allowed to participate in those programs, but they can't during shift. Next slide. Now I'm going to talk a little bit about our dispatch services and how they're being affected and some of the changes. So Lane County Sheriff's Office is becoming a de facto regional dispatch center due to smaller agencies unable to continue to have dispatch centers. Over the past few years, the Sheriff's Office has seen a increase in patrol staffing through the SRS funded positions. And the LCSO Dispatch Center has also expanded our dispatching services with new contracts, including those with Lane County Behavioral Health Mobile Crisis, Junction City Police Department, and in recent years we have also added dispatch contracts with Coburg Police, Lane Community College Security, Parole and Probation, Oak Ridge Police Department, and Oak Ridge Fire and EMS. Each of these contracts has resulted in increased radio workload and in some cases a rise in phone call volume. However, despite these increases, our dispatch staffing has remained unchanged at 15 FTE for 20 years. This growing workload not only has the potential to impact officer safety by reducing the available radio airtime during critical emergencies, but also brings with it a greater potential for higher levels of dispatch burnout. Next slide. Some of the Sheriff's Office key initiatives in the Operations Support Division one of them is the radio system. So House Bill 5202, grant funding project that is currently in progress to install microwave links for upgrades and redundancy, and some new site extensions to the coast and to the South County regions, totaling 5 overall link installation upgrades. However, due to rising costs, we're able to accomplish less than we anticipated, but we're continuing to move forward with as much as we can with the resources we have. Recruiting and retention, the Sheriff's Office hired 24 new employees this current fiscal year, but we had 21 retirement separations during the same time period. Even though this shows us gaining 3 employees, in reality, we are going backwards due to on-job training requirements. Training remains a key initiative for the Sheriff's Office, with the Sheriff's Office continuing to adjust to changing state laws and training standards. We not only meet the standards set, but we try to exceed the state standards when possible. The current fiscal year, our staff are averaging 60 training hours per person. This is an astounding amount of training considering the amount of workload each person has. This is another shining example of our staff going above and beyond, wanting to learn and keep up with best practices. The Sheriff's Office fiscal section manages almost 200 contracts with just 1 FTE. Those contracts include law enforcement agreements, dispatch, radio network to include space and land leases, towing companies, treatment providers, equipment purchases and installation. And along with that, fiscal manages over $10 million in grants, with around 35% of that is for treatment courts. They are also the financial managers for the LRIG radio group as well as the Southwest 7 radio group. And then at the center of all this for key initiatives for the operation support is health and wellness. Just a few short years ago, the Sheriff's Office took a huge step forward in prioritizing the health and wellness of our employees by creating a facility that supports the 4 major pillars of health: financial, spiritual, mental, and physical health. The Sheriff's Office has built this amazing program in a facility that has the possibility of being demolished. This could set the Sheriff's Office backwards by years if this was to happen. First responder health and wellness is one of the most important initiatives a county can support. There are multiple studies that show first responders are at higher risk for cardiovascular disease, suicide, and a shorter life expectancy. For law enforcement, most studies show life expectancy to be around 60 years of age, compared to the general public being 79 years of age. The law enforcement average age for a first heart attack is 46 years of age, while the general public is 65. If we want to help change those statistics, then we must continue to invest in that change. Even the state is recognizing this and working to lower the age of retirement back to 50 for first responders due to the high stresses of the job. There are few jobs in the world that you can go from the highest of highs, such as saving a life, to the lowest of lows, like fighting for your life in the same day. And we have employees doing that on a regular basis. This is a top priority for the Sheriff's Office. Next slide. Some of the future challenges that the Sheriff's Office is facing in the Operations Support Division. Public records requests are coming in at an increasing rate. This creates a time burden for our limited staff, since these can be very time-intensive requests. Another challenge for the Sheriff's Office is facing legislative changes, such as Measure 114, which affects the workload of our staff with no budgetary assistance to help accomplish the extra requirements. This again sets the SO back and forces more work on limited staff. We're currently under contract negotiations. The Sheriff's Office fully supports our employees being paid a competitive wage, and we know this next contract needs to reflect that. However, that does put a strain on the overall budget of the Sheriff's Office. And finally, one of the biggest issues the Sheriff's Office faces is how inefficient our work area is in the courthouse. We don't have a true lobby area for the Sheriff's Office. Currently, the public have to sit in the public hallway, which is not professional. The current setup offers no privacy for individuals coming to the Sheriff's Office with sensitive matters. The area we work out of was never designed to be a Sheriff's Office, and safety is a major concern with our current layout. We have a public corridor that splits our office and creates issues for staff. We have no water on one side of the public corridor, which means no restrooms easily available for those employees. Our dispatch center is located right off the public corridor, which also has a glass window next to an emergency exit for them. This doesn't meet the best practice standards for dispatch centers. With all the modifications that have been done to our layout over the years, it has created dead space and the inability to function properly with the needs and requirements of the community. I want to thank you all for the time that you've given me, and now I'd like to pass this off to Lieutenant Tom Speldridge, or AIC Captain, I should say.
Thanks, Ryan. Hey, guys. Thank you, Chair, Committee, Commissioners. It's my honor I get to talk to you about the Police Services Division today. The Lane County Sheriff's Office, we're the de facto law enforcement agency for all of unincorporated Lane County. We serve as the primary police agency for approximately 119,000 residents. We are additionally contracted by the incorporated cities of Cresswell and Bonita to serve as their police agencies. We also have law enforcement contracts with the BLM, Oregon Dunes National Recreation Area, the Oregon State Marine Board, a private timber association, and Lane County Public Works. General funding currently funds 25 patrol deputies. There are an additional 5 patrol deputy positions funded by one-time Secure Rural Schools funds. This funding allows for minimum staffing levels of 3 deputies and 1 supervisor to respond to emergency calls for service within our service area of approximately 4,600 square miles. This is roughly the size of the state of Connecticut. Our entire search and rescue program includes 3 paid coordinator positions and nearly 160 volunteers. Following the 2020 holiday farm fire disaster, the commission was able to utilize reserve funding to provide 4 district deputies. 2 deputies were assigned to the McKenzie Valley and 2 were assigned to West Lane. The funding for 2 of these positions has now been depleted and they were eliminated at the beginning of this calendar year. The funding for the remaining 2 deputy district positions is expected to remain in place through June of 2026. But it should be noted, this is an important program to the communities that they serve. The elimination of these positions will have a substantial negative impact on these communities. This is going to leave residents to rely on the deputy response for main office patrol again. Investigations are likely to be placed back into the main office patrol queue, and crime and traffic safety issues in these areas are likely to increase just because of the geography, the size of our county. When we're running with 3 main office patrol deputies, it takes them a while to get to some of these rural communities that these district deputies currently serve. So unfortunately, this is one area where we're moving backwards. Okay. In 2021, the Public Safety Coordinating Council provided an update to the board regarding what progress had been made towards the guidance offered in the Lane County Public Safety Repair Plan. In forming this plan, a study was conducted by the Police Executive Research Forum in 2013 that warned that staffing levels needed to be increased to at least 30 general county patrol deputies just to maintain current service levels without risking high staff burnout and turnover rates. Go ahead, Tim. We were able to at least move the needle into the beginning of phase 2 of this plan in 2022 when the board allocated the one-time Secure Rural Schools funding to fund 5 additional patrol deputies, a sergeant, and 2 detectives. That was very helpful. This includes our 1 property crimes detective. He's a busy guy, by the way. While this was achieved behind the suggested schedule, it was still a move in the right direction. But now as we move towards the end of 2025, thanks, Tim. Not only are we not meeting this schedule of the Public Safety Repair Plan, but we're now looking at being forced backwards, back to phase 1. And it should be noted that this study and analysis was completed 12 years ago. Our population numbers and the need for law enforcement services has only increased since this time that the study was done. So here's a glimpse of how the law enforcement staffing at the Lane County Sheriff's Office stacks up against our 5 comparator counties. Lane County is able to staff 0.2 deputies per 1,000 population. This is less than half of our comparator county average of 0.44 deputies per 1,000. We would need an additional 87 deputies to match the comparator county average. Lane County also, on top of that average disparity there, Lane County has by far the largest geography, the 3rd highest population, and the lowest law enforcement deputy staffing of the 6 compared counties. And the lack of this adequate staffing, it results in things such as delayed response to emergency calls for service, a diminished capacity for criminal investigations, officer safety concerns when responding to calls. We just don't, dangerous calls, we just don't have the manpower a lot of times. But then also, it causes staff burnout. I wish that I could tell you that if we don't do something soon, we're going to be seeing staff burnout, but the reality is that we're already there. Since just December of 2024, we've lost 7 of our certified patrol deputies to other local agencies. This is a quarter of our main office patrol staffing that have departed for what they believe to be greener pastures. Amongst those choosing to depart, workload disparity and inadequate pay were both cited as primary reasons for leaving. The people leaving are experienced staff with specialized training and operational value, including canine certifications, SWAT certifications, detective credentials. 4 of the 7 were active field training officers at the time of their departures. This departure of experienced staff has placed an even heavier workload on those that are still here. The extra burden of training additional staff has directly impacted our remaining employees in our community. Training and certifying a deputy for solo patrol takes about a year, not to include the costs that are associated. This includes several months at the DPSST Academy, several months of on-the-job training paired with a field training officer, and several more months of direct supervision and evaluation to make sure that they are adequately doing the job. During all of this time that we're training them, we're incurring the expenses related to their employment before they're even able to perform the job as a solo deputy. In addition to our funding challenges, the hiring landscape for qualified and dedicated public safety professionals has become extremely competitive across the entire country. We recently lost 2 prospective lateral patrol deputy candidates to other area agencies for workload and pay disparities. Additionally, 2 of our police services sergeants recently retired and took positions with other local law enforcement agencies. Your remaining Lane County Sheriff's Office law enforcement deputies are currently working overtime just to simply meet minimum shift coverage. Thank you, Tim. So, inadequate funding, though, it reaches further than just staffing issues. The Police Services Division, we continue to operate in a space that's undersized, inefficient, not designed for police use. Depicted here is our briefing room / break rom / evidence processing area. Modern police stations usually include a dedicated area where evidence may be analyzed, inventoried, and sealed in a manner that is separate from passerby and day-to-day business operations. Our space is cramped and often being utilized to process and package evidence while briefing operations are taking place simultaneously just feet away. In addition to the reduction in the district deputy program, future challenges for us include the impending expiration of funding for 8 additional law enforcement deputy positions. The SRS funding allocated by the commissioners on 22 to move us into phase 2 of the public safety repair plan it's anticipated to run dry in fiscal year 26. And this is going to include, like I said earlier, 5 patrol deputies, 2 detectives, a sergeant, and this unfortunately is going to bring our already unacceptable, poorly average when compared deputy ratio. It's going to bring it even further away from where we want to be. Funding challenges also intersect with our ability to outfit our current patrol staff. Rising costs, everybody knows that everything is getting more expensive in life. Rising costs for stuff such as patrol car purchasing and outfitting continuing to increase, and we're really having trouble keeping up. And some industry standard equipment that often isn't thought of, such as body-worn cameras, have previously been purchased utilizing one-time funding. As these items age out, which they do, and require replacement, which they do, we're still seeking ways to keep them in the hands of our staff. And the public expects us to have equipment like body-worn cameras, and less lethal force options like tasers. Without additional long-term funding, we run the risk of falling behind these expectations of these industry standard equipment at this point. Thank you, Tim. Unfortunately, Lane County does also remain a statewide leader for traffic-related fatalities in Oregon. Just between July of 24 and February of 25, where I've got the stats pulled here, we've had 30 fatal traffic incidents in Lane County. This number is up even from last year. Grant monies filtered through NHTSA and ODOT do aid in a small volume of overtime traffic safety patrol, but these events mostly target specific holidays and events. Really, if we want to address how dangerous our roads are, we need to have some kind of dedicated traffic safety enforcement. And we have zero funding for that enforcement at this point, and our call volume, it rarely allows for our patrol deputies to proactively conduct traffic safety enforcement between their calls for service. Phase 1 of the public safety repair plan was to retain our current resources. Our people are very important to us, not only from a business standpoint, but on a personal level. We really look at our people as our family members at the Sheriff's Office. While we're making every effort to maintain morale and fitness, this job is difficult enough without the extra stressors of inadequate resources. It is imperative that we retain our current people and avoid a further backslide that will affect the communities we serve in a very negative way. Other police agencies often include lucrative lateral incentives and higher pay. That ultimately made a departure from our agency appealing to some. And we've got to find a way to stop this. As previously discussed, it takes a lot to train any deputy sheriff, let alone a police certified one. Of the 7 deputies that departed for other local agencies since December, they took with them 14,156 dedicated certified training hours that we had invested in them. And not only is this a loss from an operational standpoint, it's really expensive. Much of this training requires overtime to backfill while folks are trained because we're running at minimum staffing levels. And while our team, we're working vigorously to train and certify the replacements, but this type of impact is one that it's going to affect us for years to come. So, but I do want to say, I'm so proud of the folks that I work with. Just some of the hardest working, most internally motivated people that I've ever met in my life and expect to meet. So I'm just very proud of our agency. I do want to pass this presentation over to Lieutenant Jason Moore of the Corrections Division. I want to thank you guys for taking the time to let me talk about some of the challenges that we're facing right now. And yeah, thank you.
Thank you. Thank you.
I'll take your seat over there.
Thank you, Lieutenant.
I don't have one over there.
Thank you, Chair. Thank you, Commissioners and committee members. My name is Jason Moore. I'm the Alternative Programs Lieutenant at the jail. And I want to start out by just giving an overview of our facility. We are a 411-bed facility. Our biggest contracts within the jail are medical and mental health provided by WellPath, and our food and laundry services provided by Trinity Services Group. Our alternative programs section is managed out of the Defendant and Offender Management Center. These programs are electronic monitoring, sheriff's work crew, community service, and our sit-in program. Next slide, please. Some of the changes that we have coming up for this fiscal year. This year's proposed reductions include 1 jail security lieutenant and 1 deputy in the Offender Management Center. The Offender Management deputy is responsible for performing initial and ongoing classification reviews of everyone in custody and their current behaviors. They also are responsible for assisting interviewing individuals to obtain risk scores to help determine appropriateness for alternative programs, and using these scores to make capacity-based decisions when needed. And finally, they are tasked with working closely with pretrial services to clear warrants without individuals having to go through the booking process, saving time and resources by bringing them in to the Sherman Center rather than into our booking area. Removing this position requires the workload to be redistributed to other deputies assigned to the offender management and AIC programs. The corrections lieutenant position, the current workload supports the need for 3 correction lieutenants. Having this position also provides career growth opportunity for sergeants, making succession planning more robust for the overall health of the sheriff's office. Without this position, the workload will be placed on 2 lieutenants, and the opportunity to develop future leaders with practical experience diminishes. Next slide, please. So what are some of our key initiatives? Research shows that individuals who are able to maintain employment, housing, and community ties are less likely to reoffend. Our alternative programs, such as EMP and Sheriff's Work Crew and the community service, provide individuals opportunity to continue being productive members of the community while maneuvering through the court system, serving their sentence. These programs also keep more beds available for higher risk individuals. Alternative programs are a critical component of the justice system that benefits our community in the long run. Our electronic monitoring program provides another resource for pretrial services to encourage compliance with release conditions while also increasing community service. Electronic monitoring program has built partnerships with parole and probation and the drug court to provide another avenue to encourage compliance for their programs. The Sheriff's Workroom Community Service Programs offer alternatives to incarceration, where sentence offenders find means to them to fulfill their individual court requirements while maintaining their pro-social connections, housing, and work schedules. The Sheriff's Work Crew provides parole and probation an alternate sanction option that would otherwise occupy a jail bed while still maintaining accountability. Community service has great working relationships with several nonprofit agencies. In the last fiscal year, over 5,000 service hours were provided for Food for Lane County, Goodwill, St. Vincent de Paul, and Bring Recycling, and to a variety of smaller agencies. The community service program is a resource to our local court, where 259 folks resolved over 600 court cases. Community service not only supervises individuals within the borders of Lane County, but throughout the country. For instance, recently someone was sentenced to 180 hours locally, but they live in Tennessee. We were able to coordinate with local nonprofits in Tennessee to facilitate the completion of their service hours in their own community. In 2021, we developed a medications for opioid use disorder, MOUD, program for the adults in custody that have substance abuse disorder. During the last 4 quarters, we had 331 people on MOUD. We need MOUD in the jail for reasons such as ADA requirements, legal ramifications, not to mention the moral obligation to provide help to those that we serve. Funding from the opioid settlement for MOUD program is not sufficient to fund a robust program that would include injectable medications. We were awarded a grant to obtain a limited supply of injectable medications. However, to have an MOUD program that truly encompasses all forms of medications, greater and stable funding is needed. This program is effective. For instance, we recently had an individual book in and spent about a month in housing struggling with behavioral and disciplinary issues. We were able to get this individual started on MOUD medications and mental health medications. Once they were stabilized, they participated in our wellness program and gained insight and skills they needed for their recovery goals. By working with Lane County Forensic Intensive Treatment Team program, this AIC was able to secure housing at a sober living home and use the momentum started at the jail to maintain their recovery goals. Today, they are maintaining the sobriety and rebuilding relationships with family. This is just one of the many examples of our commitment to provide the best possible MOUD program in our facility, with the goal of helping those who suffer with their battle with addiction. The facility infrastructure modernization project is funded by a $17.5 million grant. Construction began in April of 2024 and is expected to conclude by September of 2026, making it a large-scale and long-term endeavor. The scope of work involves a complete replacement of outdated systems, including detention control, fire alarms, video surveillance, and our central control. The existing systems, some of which date back to 1979, no longer meet modern operational needs and fail to align with current best practices in corrections. Given the size and complexity of the project, we anticipate operational challenges, especially as construction impacts individual housing areas and critical systems. However, these improvements are necessary for improving staff efficiencies and enhancing the safety and security of everyone in the facility. Next slide, please. So what are our future challenges? We recently finalized RFPs for our kitchen and laundry contract and our AIC telephone contract. Trinity will be continuing to partner with LCAC and will be investing in new equipment in the kitchen and laundry without increasing initial contract costs, which is really good news for us. We have a new partnership with Smart Communications. We'll be replacing Viapath. This new partnership will bring over 20,000 hours of learning and course content on the handheld tablets that we started up about 2 years ago. Digital access to facility forms, such things as request forms and commissary ordering and that kind of thing can now be done electronically, saving us money and printing costs. The new digital signature capabilities will help attorneys quickly provide their clients with legal documents requiring signatures. This will increase operational efficiencies for both the courts and the jail, allowing them to take care of that business without the attorneys having to physically come into the facility. We're also working with the state and WellPath to establish a process for the Medicaid 1115 waiver to potentially subsidize AIC medical costs. This 1115 waiver allows Medicare and Medicaid eligible AICs to be covered on a limited benefits plan. This is challenging work because the infrastructure doesn't currently exist and must be built from the ground up. We did, however, learn just a couple of days ago, and as the Chief Deputy alluded to, that this process has been put on hold at least until January of 2027. And at this point, the status of the entire program is still unknown for many, many factors. Our aging building needs, the jail opened in 1979 has undergone 2 additions over time. However, the use of the facility has outgrown its design and layout. Inefficiencies, resource-intensive processes, and supervision challenges arise due to architectural styles of the building and the current population of AICs who are housed. A remodel of pretrial services is needed. The area is too small for the number of people who work there. There's very little natural light that comes into the area, and the remodel would significantly enhance operational efficiencies. An HVAC chiller that we use for air conditioning in the summertime needs to be replaced. This regulates the temperature in housing areas where the AICs reside. This was installed in 1998 and is well past its life expectancy. It is imperative that we provide adequate heating and cooling of AIC living quarters and staff workstations. Our kitchen and laundry facilities, the sewer lines that run underneath our kitchen are located under a concrete floor, and quite frankly are a ticking time bomb. They are at very well past their lifespan. They're from the original construction of the facility, and they are starting to fail. The kitchen, freezer, and walk-in coolers, dishwasher, and other appliances are outdated, and it's becoming increasingly harder and harder to find not only parts, but technicians that know how to work on the outdated equipment. The efficient meal preparation and distribution of up to 1,360 plus meals per day and approximately 21 commercial-sized loads of laundry each day is crucial and a statutory requirement. If these utilities fail, we will have to outsource both meals and laundry. Our current contingency plans include finding an off-site kitchen and off-site laundry facilities, or providing a mobile kitchen and mobile laundry facility should this occur. These costly plans, though, will force us into a position of having to dramatically reduce the AIC population in order to feed and clothe the ones that remain lodged. Thank you very much for allowing me to present this today. I'm very honored to do it, and I will now turn it back over to Chief Deputy Woodson.
Thank you. Well, we are uplifting today, aren't we? I want to just kind of say that, you know, our presentation today is to point out some of the challenges we have. But I also want to assure everybody on this committee that with our budgetary restrictions, that does not stop the leadership team and our staff from being progressive in how we do things. There's outside the box thinking on a regular basis. Our jail is leading the state in programming. People are looking to the Lane County Sheriff's Office on how we do things. Ballot Measure 48 is a direct reflection of the state moving into a model of how we operate. So we have good things here, but we have to point out the obvious that we are in desperate times, and I know that this budget committee knows that. But at the same time, we have amazing staff. We're extremely proud of them. They work their butts off, and we're fortunate that we have the folks that we do. So I'll close up with that positive note and open up to any questions we have. I would like to point out real quick that the brains behind the operation, our fiscal manager, Debbie Howler, is not available today. So any dollars and cents questions I may have to get back to you on. So.
Great, thank you. Questions from the committee?
Well, just, I mean, appreciate all this, but it's, yeah. Does anybody have any ideas for solutions, I guess, is what I'll ask.
Well, in some ways, again, I talked about the fact that we are proactive in our thought processes. We're hoping that some of the budgetary investments that we've made in the ARPA funds at the jail will create some efficiencies in the way we do our operations so that we can, well, frankly, keep using the levy because we're outspending the levy right now. We're hoping some efficiencies will allow us to do some staffing restructuring and do that. This committee, I think, has heard that there is the Public Safety Funding Task Force that I believe will be presenting a suggestion to the board in the near future, and I will work hard with them to develop whatever plan that they propose or whatever plan the board comes up with in supporting. But this really is a dollars and cents issue. I mean, most of this is a dollars and cents issue, and we can be proactive as much as we want all day long and do outside the box thinking, but there are just a lot of things that are outside of our control. And an example of that is we used to spend about, maybe DJ is the best person to ask, wasn't it about $40,000 to purchase a patrol vehicle before? And now we are, between build and purchase, we're up at around $90,000 patrol vehicle. So that's nothing we can control. And so I can assure you that you have my commitment that I will continue to look for ways to, not step over cents to pick up dollars. But we have a challenge ahead of us, and we're going to continue to do our best. So.
Yeah, thank you. Thank you so much, and congratulations and condolences. I thought we would get Sheriff Harold here one last time. But thank you for a presentation. Thank you to all of you for your work. And it is sobering presentation, but it's also reflective of what every department is. I mean, every presentation before you has been similarly challenged with, if not actual shortfalls with what we're anticipating could potentially come our way depending how things go. So it's quite a note to end on. My only question, and I see Debbie did join us, and is a dollars and cents one, is just clarity on the federal revenues are anticipated to increase by 280%, and then there's the fund transfer of 248.78. What are those lines made up of?
Debbie, can you hear?
I did forget to bring my budget book with me today, so I will have to write that one down and get back to you.
Sure, it's page 345 of the proposed budget under operations support.
Thank you.
Yeah.
My guess would be it's federal grant funding, but I'd have to go and look and see exactly what that entails.
And so with fund transfers is just a sort of reorganizing of existing money, but it's showing up as an increase because we're increasing the transfers, but it doesn't necessarily have a net dollar increase effect on the department?
Again, I need to look at what it is you're looking at, and I apologize that I ran out this morning at 6:30 and forgot to grab my book.
That's funny. Thank you. Thanks for that.
Great. Any other questions, Commissioner Lovell?
Yeah, not really a question, but just a statement, and I hope you take this under Sheriff Wilkerson as just support for you and your staff. Our district attorney, Chris Prose, has said that he believes in fair and ethical prosecution promotes social order. And after hearing his testimony of the DA's office, the youth departments, the parole and probation, your case, I mean, it seems to me that if we continue as a budget committee to erode our protection and our public safety system, our social order is also going to unravel. Would you agree with that statement?
Yeah, I have to say that I will always argue that public safety is a core function of government, and that we need to make sure we are at least funding that at a acceptable level. So.
Yeah, I agree. Well said.
Commissioner Buck?
I was hoping if there was an update on the funding allocation for upgrades in the jail. We did a decent amount of funding, I think mainly through the ARPA funds, and I was just wondering how that was going, if it's complete, are we still in the middle of it?
Well,
Was that the 17?
let me take a stab at it.
8 million?
19 million.
Okay, as Jason was mentioning earlier, we're in the middle of it,
Okay.
and it's not expected to be, those projects are not expected to be completed until, you say, 26? 26.
So that was the, I'm interrupting you for there.
Go ahead. I'm gonna just let Greg answer this.
On the presentation of Lieutenant Moore said it was the modernization project.
Oh, that's what that was.
That's what was known for this group as the ARPA project.
Got it. Great, thank you.
Just again, to be a little bit more clear, I said that we were hoping that would create some efficiencies. Some of the things that have happened, you won't see the picture, but the picture that showed like the doors and the wires, we're hoping to be able to, like on Graveyard, for example, be able to control multiple areas from one spot and then send staff out to do our required checks and try to keep our busy work during, so reduce like one section of time and staffing and move it around. So those kind of upgrades are going to hopefully create some efficiencies in FTE costs. So.
Great.
We have completed one housing area and we just broke ground on the second housing area this weekend.
You know, some of the other parts of the projects, like the fire control panels and so some of the other projects have already been completed. We've completed the camera upgrade and so.
Great.
But the bricks and mortar stuff is what is currently happening now.
Context, how much was allocated in that?
19 million.
19 million, okay, thank you.
17.
That's what I thought it was 17.8, yeah.
Oh, okay.
But now Steve's saying 19. I thought it was 17.8 too.
Yeah, it is, yeah.
That's what I remembered from when we did it.
And that too has gotten more expensive than when we were initially costing it out.
Yep.
So we actually have had to cut some items off the list of the things that we were going to hope to accomplish. So.
Commissioner Farr?
Thank you. Chief, you mentioned we have had a funding task force that's been working. You've been present at some of the meetings. I have also. And we're going to get a presentation soon. That was to you. This is to the Budget Committee. We'll get a recommendation. We'll get a summary of the discussions that they've had. But it's not the end of the work when we get that recommendation. This is the beginning of the work. And how do we synthesize the information that we're going to get from that committee, a broad committee that's looked at a lot of different areas, and how we're going to synthesize it and knit it with the needs, the clear needs of public safety, the public health, the public, when I say public health, I mean the actual life and death safety in our county. How are we going to take that and move it forward? It's not going to just be the Board of County Commissioners, but the Budget Committee is going to have to be involved in that also, because this is going to be a budgetary ask at some point. You heard the DA asking for 0.5 income tax to get $5 million. Well, we're going to need to take all the information that we'll get, and we're going to have to, once again, begin the work, Chief, and get ready for the public to weigh in on how we're going to fund this department sustainably into perpetuity.
Yeah, that's why I wore long sleeves, so I can roll them up and get to work.
Well, thank you for the presentation. Just be prepared for this. It's coming soon.
That's good.
Thank you for the presentation. Thank you all for the work that you and your colleagues do.
Thanks a lot, guys.
Thank you guys, task force.
I just
Said nothing about my solidarity.
I tried.
Yeah.
Run a totally different some distinctions between how we do things and how we do.
So now we are a few minutes ahead of schedule. So we are at the agenda item, committee business and pre-deliberation. I'll turn it over to you, Christine.
All right, I wanted to point out to the committee that you had one other reduction memo in the stack that was given to you today. I'll just speak to it because this department's not here today. This is county administration and our policy team, and it's related to the EPA grant that you heard about that has been canceled. Because of the size of the amount of budget in policy team, they are administering the grant and doing a lot of the contracts out of the county. We need to have the budget committee take that action because it would be more than 10% change of that fund. There's also the other piece that's in Health and Human Services. They're going to wait until the stage 4 is what we call it, when the Board of Commissioners adopts the budget. Just to give a little more time for them, there is staff potentially impacted on that piece of it where there's not in county admin, so just giving them a little more time to work through those details. It's not near as high of a dollar amount either, so they can do that then. So let us know if you have any questions on the memo that they provided. The amounts, it covers a few places, maybe I'll just highlight those really quick. It's obviously the administration of the grant. There was also about $46,000 going into our grant strategy management for staff time. They will now use, they were previously funded with an ARPA award, so they can still pull from those reserves that we've been holding in the general fund, so no staffing changes there. Same thing happening in emergency management, would have been able to tap the grant for some of the staffing, but they will go back to using a little more general fund, about $42,000. So we will reduce reserves over in the sub-fund that has that money that's covering those ARPA funded projects, and then the emergency management in the regular general fund reserve. So those are the changes. Any questions on that? Okay.
What happens, I mean, we haven't fully resolved, and none of the council's in the room, so it may even be a question, if we want to contest the cancellation of the grant, I guess we just, do we do it? Let's say magically manifesting, it is reinstated. Does it almost sort of become like a new grant that we just re-receive and then, okay.
We are going to go through the appeal process,
Yes.
which is an administrative process. If that appeal process is not successful, then we will have a conversation with the board about any additional action we could take.
Okay, thank you.
Okay. So then the pre-deliberation discussion, you have a handout, you've seen this before, so we haven't changed it. But just changing who to send if you have any suggested changes as a committee member that you would like the committee to consider next Tuesday when we have deliberations, if you could please email those to me before Monday at about, I think I said noon, 9 a.m. I guess I didn't give you till noon. 9 a.m. to noon, somewhere in there. I just want to, time to put it all together and get it out to you in an email by the end of the day. And we will post it on our website by the end of the day. So that just lets everyone know what will be discussed on Tuesday evening. So just going through this is just kind of that process of once we have your list, those will be things that the committee will decide and see if you have at least 4 votes to discuss them. Then you'll kind of go through and deliberate on each of them. Under number 3, you will have a bigger list than you're used to seeing with the memos that you've received from H&HS and then this EPA grant. So that's where you would consider those changes. And then discussion about the entire budget. And then we'll have the motions for you, which will look very similar to what they have in the past, yes. So any questions or discussion for the committee? I'll turn it back over to you on that process.
For number 3, do we vote on each one separately or in total?
Really your choice, probably. I think we list them separately, but really, if you decided as a committee to take one vote to include them, yeah, they really are changes that are needed, as you heard from the department, because revenue has changed or.
So probably one vote on all of them?
Yeah, we can change the setup, but yeah, we'll make sure it's set up that way then to make it easy. Okay.
Other questions from the committee? Okay.
Sure.
Great. Well then, I think we are at the end of our agenda for today, unless there's any other committee business.
The only thing I would say is there was a kind of a highlight there for pre-deliberation. So we obviously have the whole group here now. If there's anything that people want to make a statement to, so you can think about it between now and Tuesday, for example. So I don't have anything other than I thought today was a bit depressing. Heartfelt about it, right?
Yeah.
So, you know, I live in a remote community. I have seen and I've heard from my fellow citizens there a degradation in civil order. People running into situations that they shouldn't have to as far as a safety. I think that I have great faith in what the Sheriff's Department is doing with what it has, and what the DA is doing what they have. But there are individuals in the community that you literally need to avoid coming into close proximity with them, because they're already known to the sheriff's deputies in the community, and you know the DA is, you know, taking the caseload that they can take, but it is a sorry state of affairs as far as the public safety system is concerned. This is nothing necessarily new, but it compounds over the years, and to state this, I don't know if this is the right way to say it, but the community of offenders is growing, right? So there's more and more places that you have to literally be careful. And we live in the state of Oregon. You know, it's not like we should like visiting a place in Mexico where you stay out of this area of the community, but it's getting close to it in some areas. So I do look forward to how the task force comes and brings things forward. I have put myself out there before that I think that there is truly a broken funding model in this county. It's been presented to us in multiple cases. But it is one of those things where it's getting more and more out there. So that's why I say today is depressing. I do appreciate the work of the individuals we have that are continuing to work for the county. One of the things I was sorry to hear was the leakage of trained deputies. You know, coming from my business background and so forth, when you invest the type of money that is invested in training professionals and bringing them into your family, to lose them is you have to do everything you can do to avoid that. To let that leakage, it's actually kind of more of a spiral, because now all of a sudden you have to spend more money to train and recruit new people. So that's my soapbox for today. That's my deliberation move for all this thing.
You got room for all of us on that box?
Well, I think if I could, I think it's right that we grouped the programs we did today, because you can't decouple them, right? Disinvestments and underinvestment in the behavioral health system is part of why you're seeing what you're seeing in an increase in number, but also the severity of the challenges people are facing. So those upstream investments also make a real difference in what the Sheriff's Department's facing.
Well, and all of today's presentations made me reflect on the last set of presentations, the county assessors, where we know that we have 64% of the staff needed to collect the taxes and do the appraisals, so it just all fits together. Other thoughts or pre-deliberation comments?
I'll just say, I came into this year sort of, like, where I sit, you know, I also deal with funding challenges at a state level, and so none of this all feels very, very familiar. I'm looking forward to a day where we can start to talk about solutions to these problems versus just putting the Band-Aid on the broken arm year after year. And so I'm hopeful that we're getting close to that, particularly with this task force for public safety, because that is a big one. But it's across the board in local government, state government services. Everybody, I shouldn't say, many programs and services are underfunded, which speaks to the funding model and the structure that we have here in the state, likely. But more solutions. We need more solutions on the table.
And I'll say, on this note, we could be depressed, and there's certainly depressing news, but now's not a time to be depressed. Now's a time to be galvanized. We've all heard the same message. We all have the same gut feeling inside of us what that message means to us. And now's the time to galvanize, get together, and be motivated to find something. And it's not going to be easy. They're not just going to come and say, here, we've figured it out. That's not going to happen. They're going to give us some of the deliberation, some suggestions, but we have to make certain that we can provide a package that is going to be not just acceptable, but cheered with the public. If you look at our jail levy, every year, more and more people, every 4 years, more and more people support it. Well, people want public safety. Let's get galvanized behind that and give it to them. You know, I mean, that's what we're here for.
Hopefully so. Just to tell the committee that June 24th is when we've scheduled the presentation from the Public Safety Funding Task Force to be presented to the board. We had tried to get it in the next couple weeks, but we want to have the co-chairs, chair, vice chair, co-chairs of the task force present. And so June 24th was the date that worked best for them. The report is sort of very close to being finalized. It's been circulated. The recommendations are in there. And so that will come forward on the 24th. And I can't remember if it was Commissioner Farr or someone else mentioned, that's kind of almost the starting point, right? That'll be the starting point for the board to talk about what direction it wants to start to look at going, and a lot of work will need to happen after that. But we've spent about the past year working with that task force to come forward with a series of recommendations that the board can ultimately consider.
Is that presentation, Steve, going to come at the board meeting that day or
Yes.
after?
That's the plan. We're trying to find a time, the 24th or 25th. Yeah, it'll be in the board meeting.
Okay, thanks. I guess the last comment that I have, if we have time, is, Shark Tank, Mr. Wonderful always says it's best to cut deep, so you only cut once. And it just seems like as we hear a lot of discussions about what we cut, what we can't cut, do we cut deep first with asking the citizens for more money to solve the issue? Do we cut deep by drawing the line on what government can actually do, what services we can take on anymore? Do we have like a pause with that for a while until we catch up? So that to me is kind of what's going on in my head is, I keep saying this, I think the last two budget cycles, is how long can we continue to dilute things and do things minimally, where we're hearing now public safety is now but we're back to the highest offenders now, and Herb has spoken to that, in a rural community where that's starting to affect people directly. Now we're only dealing with the people that are the baddest of the bad. We're not dealing with the people that are just habitually bad. So that's concerning.
They're all high risk, is what the lady said. It's all high risk.
If I could real quick, I do think, I heard somebody mention the jail levy and so forth. I think the jail levy has done a really good job of instilling, or basically, it has encouraged the trust level in that financial model, because it was put out, the sheriff and the other stewards and so forth were really clear in their reporting and being accountable to what they put it out for, which doesn't always happen, right? When a levy like that goes out, sometimes it gets diluted or sidetracked or whatever. So I think that levy's been an important first step, because people feel confident that they were paying it and that they were getting what they paid for and what they said was going to be done. And anything that comes from the task force, I think, needs to go along that same way and make sure that there's ultimate true visibility in that lock-in. I don't think that anybody's looking to reduce the amount of funds that are coming out of the general fund, for example, and so that they can go off to other services. Not that other services aren't important, but it is, those property tax dollars, one of their primary functions is public safety. So I don't think that they want to pass some new funding source and then use old funding sources for other purposes. City of Eugene, anyway. But so I think that we've garnered the trust, and I don't want to waste that. I hope going forward that we can do that kind of truth in advertising, put it out there, and do what we say we're going to do with it. So,
Promise the world and account for it.
All right, I think at this point, we have covered our agenda items. I think we are now ready to adjourn at 4:35. Thank you all.
thank you.